Try to. Try to.
But
Try to.
so give them the UI of let them go to the pig and see if on their phone. Let me check. Can I have your number?
2. Testing mic 2. Testing mic 2. I want to talk as little as possible, but anyway.
morning, everyone. Oh, good morning and wake up, please. Good morning, everyone. Thank you all for being here. Our distinguished guests, esteemed speakers, our sponsors, and all participants, you are welcome this morning on behalf of the local organizing committee of the Pamca to this conference. I hope you are all as enthused as I am to get engaged with the insightful presentations we'll have, the in-depth discussions, and make this an opportunity to form meaningful networks. And at this point, time is fast spent, so I will call on the president of the Ghana chapter, Dr. Kojo Frimpong, to come forward and give us the welcome address. Please give him a round of applause.
Thank you very much. So, the African Mosquito Control Association, the international community, the African Mosquito Control Association, Ghana chapter, special guests, distinguished speakers, participants of this conference, ladies and gentlemen, I welcome you to this maiden scientific conference of the Pamca Ghana chapter. As together we celebrate knowledge, foster collaboration, and pave the way for future innovations in the field of vector control. As the president of this association, I feel very honored that together we have achieved our aim of organizing a local scientific conference in Ghana. This marks a significant milestone for us, since it is our first scientific conference as a chapter. We are excited to bring together from academia, from research, public and private institutions, individual organizations with the aim of controlling mosquito-borne and other vector-borne diseases under the theme harnessing academia, research, public and private institutions for effective vector control in Ghana. Although majority of us might have attended several international conferences, we may not know the expertise that we have in country as a chapter. Through this conference, we hope to create a vibrant platform for exchanging ideas, sharing groundbreaking research, and then fostering meaningful collaborations that will shape the future of vector control in Ghana and Africa. Over the course of the conference, we will have the opportunity to engage with leading experts, participate in insightful discussions, and update ourselves with some new developments in our field of study. The Pamca Ghana chapter's vision is to have a Ghana free of mosquito-borne and other vector-borne diseases. The mission is to promote research and control of mosquito-borne and other vector-borne diseases and work together towards their elimination in Ghana, Africa, and beyond. I am very confident that this conference will serve as a catalyst for the continued growth and success of Ghana chapter. I would like to express my profound gratitude to the distinguished speakers, panelists, conference organizers, that is the subcommittees, and the founding executives, and all who are here, because we work tirelessly to make this possible. Without your unwavering support and dedication, this conference would not have been possible. I also extend my deepest gratitude to our sponsors and partners who, through their generous contributions, have made this event a reality. To all who have participated in this conference, whether physically or virtually, we say thank you for supporting this vision. To the presenters, well done for agreeing to share your knowledge with us. Let us put in our best as we embark on this exciting journey together. To me, this conference is just a dress rehearsal as we plan to host the Pamca International Conference very soon, hopefully next year if given the opportunity. Once again, you are all welcome to this maiden scientific conference of the Pamca Ghana chapter. Thank you very much. So at this point, I would like to invite some personalities to the high table so that we continue with the program. So I would like to invite Mr. Sylvester Segbeya, who is the Chief of Party for PATH. A round of applause as we invite him to the high table. I also invite our own Professor Kwejo Ansankoram to the high table, who is the former director of Noguchi Memorial Institute for Medical Research. Thank you very much for honoring this invitation. I'll hand over to the MC to continue. Thank you very much.
Thank you, Mr. President. When the president wears the traditional cloth, you know that we mean business. So, and another good morning to us all. I see that some people are settling in, settle fast, because we are really going to zoom into business very soon. We have so many dignitaries with us. We appreciate all of you for coming. Danielle intentionally didn't mention her name, but you all know that she's the MC. I hope you all know. So Danielle will be doing this with myself, Christian. We'll be honored to serve you today, tomorrow, and hopefully we would have a successful maiden conference. And when you say maiden, it feels good. Let's clap for ourselves. We've done this together, and it has been wonderful. I don't know myself to be speaking a lot of bass, so please, when you see me speaking differently, don't be surprised. It's the microphone. So give me my original voice. I think President was speaking alto, but it's all good. We'll increase the volume. I hope everybody can be heard at the back. Can we all hear at the back? We're all good. All right. Okay. So at this point, we will introduce Reverend Mrs. Gloria Obeng to do us the honors of introducing the chairperson. Thank you.
Thank you very much, Chris. A very good morning to you all. Oh, I didn't hear you. A very good morning to you all. Great. Oh, we have not taken some breakfast this morning. Don't worry. Right. So, our chairperson for today is a public health specialist currently working with PATH Ghana as a chief of party for the PMI Reach Malaria Project. He has previously served as a chief of party for the Vector Works Projects 2017 to 2019, which supported the distribution of ITNs through schools, antenatal clinics, and child welfare clinics. He also led the Breakthrough Action Project from 2019 to 2023 to strengthen social and behavior change communication on prevention of COVID-19 and other priority zoonotic diseases in Ghana. Between 2011 and 2017, he worked with the Anglo-Gold Ashanti Malaria Control Program as a program director to scale up indoor residual spraying from 1 district to 25 districts across 6 regions in Ghana. This intervention contributed significantly to the overall reduction of the national malaria disease burden. He worked with the National Malaria Control Program from 2005 to 2011, where he led the deployment of various malaria control interventions across the 5 northern regions of Ghana under the Global Fund Rounds 2 and 4 funding mechanisms. He holds a Bachelor of Pharmacy Honors degree from NUST, that's the Kwame Nkrumah University of Science and Technology, and a Master's in Medical Education from the University of Dundee, Scotland. He has been involved in several studies in malaria control and prevention in Ghana. Ladies and gentlemen, I want us to invite Mr. Sylvester Segbeya as our chair for today. Let's give him a hand of applause. Oh, let's keep appreciating him. Thank you.
Good morning, ladies and gentlemen. Thank you very much, Reverend Mrs., for the kind words. It's a great honor and privilege to be asked to chair this morning's session. I actually know that the work of chairpersons is very easy, especially when there are MCs around. But today, I must congratulate the leadership of Pamca Ghana for setting up this conference. I have been very remotely connected to Pamca probably over the last 12 or more years. And when Pamca Ghana started, I noticed that they were making baby strides. And I think that today is a major breakthrough for the Ghana chapter. And I must congratulate you, Dr. Kojo Primpo, and your team for putting this conference together. As you rightly said, I believe that is the beginning of many, many great things to come, and it's a step in the right direction. I must also commend the organizers. I know that organizing conferences like this can be quite challenging, and as I looked through the program, I was quite impressed to see the beautiful lineup of presentations as well as poster presentations that will be coming up over the next 2.5 days. I'm looking forward to very engaging discourses as well as sharing of ideas over the next couple of days. So this morning, I see a lot of my seniors here, and I want to particularly salute Prof. Fred Binka and Prof. Kojo Koram, who have been remote mentors over many, many years, and I'm looking forward to hearing Prof. Koram's presentation this morning. I also see Prof. Osan here, my good friend who succeeded me from at Agamal, Mr. Samuel Esiedu, and many, many others. Of course, my partners from the private sector as well. I see Syngenta, I see Mitri, and the whole idea that we're having academia, research, private sector, public sector, having a time to interact and share ideas is a brilliant one, for the simple fact that one entity cannot achieve this fight against mosquito-borne diseases alone. So the academics and the researchers bring together the wealth of knowledge they gather from doing all the research work. Industry brings the innovation or all the research work, packages it beautifully into products that are cutting edge, and that will help us achieve our goal faster. In 2005, when I joined the National Malaria Control Program, one of my deepest and expectations was that in my lifetime, Ghana will reach elimination. I still keep that dream, I still keep that hope, and I believe that with all the concerted effort from the multiple players around the table, that is something that we can achieve. When I did a bit of behavior change communication, I recognized the fact that a lot would change if people are well informed and if they utilize that information to take the right decisions. Most people, after many years of research on malaria, or let me use malaria because that has been my field for many years, research on malaria, what the causes are, how people, what kind of steps and actions people take to prevent and treat. It's amazing to find some of the results. We've come a long way. I see the knowledge has improved significantly, but behavior change takes time. Some significant percentage of our population still believes that malaria is contracted by working in the sun for long hours, by eating oily food, and many other misconceptions. So we mustn't give up the fight as far as knowledge sharing and education is concerned. A lot of our research needs to translate into the day-to-day life, or impact the day-to-day lives of the people that live in our communities, and it needs to also influence the the way they behave, the way they respond to these vectors, the diseases they carry and transmit, and what we must do as a people to prevent the transmission. So I won't speak a lot this morning. I want to welcome everybody to this 2.5-day conference. I'll urge all of us to actively participate in the discussions, and for all our presenters, I wish you a good time of presentation. I believe that this will be a good time for us to share ideas, share knowledge, synthesize it all into some very productive, utilizable tools as we go into the future to fight the various diseases that are transmitted by mosquitoes in our country. So once again, you are all very welcome, and sit, relax, enjoy the conference for the next 2.5 days. Thank you very much. And I would say that I also accept this opening session of the conference. Thank you. Over to you, Christian.
Thank you very much, Mr. Chair. And thank you also for being sat comfortably and ready for today's show. So we have so many sponsors who came in timely. The chair did mention that it hasn't been an easy job putting this together. We had so many people to learn from. We had friends coming in, colleagues supporting. But we needed the money. You can have the bright ideas, but you need the money. And we were blessed to have some key sponsors who came in to make all of this happen. I would want to acknowledge them. We have Mitsui Life Science and Crop Research. That's them. We have Syngenta. Can we see Syngenta? Good. We have EK Brand Consults. Good. We have Health Alliance Network, Ghana. Good. We have Efiefo. I hope you understand Efiefo. Noguchi. Let's clap for ourselves. We are here and well represented. Actually, let's clap for Noguchi again, and I'll explain. Picking a venue for a maiden conference is tough. You think through a lot of things. But for us to do it here, and President will acknowledge that we did it here with a waiver. So again, let's clap for Noguchi. Thank you. Right. We have lab mat. Lab mat. Is lab mat here? Okay, and there's I just needed to take pause. And that's Prof, your team. Acomvec. Acomvec. Did I do well? Acomvec is here. Prof Otai is here. When they take turns to say more, we'll probably learn more about them. So again, thank you to all our sponsors. The chair did mention that we have dignitaries, and of course we do have dignitaries here. He cited one big one among us, Prof. Benka. We can't acknowledge you enough. Thank you. Prof is trying to hide somewhere, but those of us who know him, we know him. Please, I'm pointing there, yes. Prof, we are really, really honored to have you here. Thank you so much. We have friends of Pamca. We have a colleague from the Pamca Ivory Coast, Chabi. Yes, I know you didn't expect that. Chabi is here. He drove in last night just to come and see how we are doing. Thank you very much. We have IVCC here, the man who is representing Ghana on the global market. He's not paid, but he's advertising smoke around the country, around the world actually. Everywhere you go, you see him here. And I would have been surprised if he didn't wear his traditional smoke. We have IVCC here. Thank you for coming. We will be having some other dignitaries joining us. We have institutions. Noguchi has been acknowledged. We have KNUST here. Dr. Bedu, KNUS. We have UG. UG is here. Yes. We have UCC. UCC. UCC should be here. Let's take it on their behalf. Everybody knows a friend who went to UCC, so we are all associates of UCC. That's what. All right. So thank you all for coming again. We will be going straight to hear a few remarks. And to begin that, I would actually bring my co-MC to take that session. We would hear from key people, just a brief remarks. They encourage us, give us some well wishes. This being our maiden one, we will hear some good wishes and things that will cheer us for the coming days. Again, thank you very much, Daniel.
Thank you very much. So we're going to have our brief remarks from some of the people who were just introduced. And being that we're having the conference here at Noguchi, the first person to give us our brief remark would be Mr. Theodore Ahono, who is the Institute Administrator, and he's here on behalf of our Director, Prof. Dorothy Yeboah-Menu. Thank you.
Thank you, Madam MC. I'm here on behalf of the Director, who will have wished to be with you, but unfortunately we have 3 important programs all going at the same time here at the Institute. So she has asked me to stand in for her for this important program. She will join you during the course of the program, either today or tomorrow. Thank you. Mr. Chairman, special guests, distinguished speakers, members of Pamca International, members of Pamca Ghana chapter, ladies and gentlemen. I am delighted to be part of this maiden conference of the Pan-African Mosquito Control Association Pamca Ghana chapter. In line with the Noguchi's vision and mission, we are happy to partner any organization that seeks to promote health. Vector control is very important since vector-borne diseases account for about 17% of all infectious diseases globally. And mosquitoes are the most important when it comes to disease transmission in humans. The Noguchi Memorial Institute of Medical Research identifies with the theme of this conference, which is harnessing efforts from academia, research, public and private institutions for effective vector control in Ghana. This is because our research activities thrive on partnership and collaborations from different sectors, and this also falls in line with the university's 4th strategic objective, which is engagement and partnership. Noguchi is a sponsor, as you've already heard, of this conference to foster collaboration, stimulate ideas, and enhance fruitful discussions towards effective vector control in Ghana. On behalf of management and staff of Noguchi, I welcome you all to our premises and wish you a successful conference. Thank you.
Thank you very much. We are grateful that you've made that remark. We promise to continue the work with engagement and collaboration to foster network in research controlling vector-borne diseases. The next remark that we'll receive would be from Mr. Andrew Day Saibu, and he is here as the Africa Regional Coordinator for the Innovative Vector Control Consortium, IVCC. Mr. Saibu, you're welcome to give your brief remark.
Thank you very much, and I will stand on the existing protocol. But there are two people I cannot continue without mentioning. Prof. Dinka and Prof. Koram. They've been my lecturers for a very long time and mentors in one way or the other. And to all of you. So IVCC, fortunately, Prof. Dinka is one of our immediate past member of Board of Trustees. He has contributed his quota in so many ways. The good news is that in his absence, when he was leaving, he got another Ghanaian to represent the Africa on the IVCC board, who is in the person of Dr. Mam, the program manager of the National Malaria Control Program. So that tells how lucky IVCC is. So it is the only vector control PDP's product partnership development. And some of our partners have been mentioned in this room. Basically what we do is try to bring in new chemistries to help in the fight of vector control. And we mentioned that, somebody just mentioned earlier, the role that vector control has played. We will continue to work with our partners. Mitsui is here, Syngenta is here, BASF is not here, Sumitomo is not here, DKA is not here. Let's not worry about the numbers we have. The fact that Ghana has been able to organize its maiden conference is key. And my message is simple. We're in a global world where resistance is a challenge. Let's continue to see what new chemistries can we bring in to ensure that we're able to manage the resistance that we are facing with. As a scientific group, I also encourage you not to only be interested in publishing and getting degrees and PhDs. How can you translate what you have published into saving lives? The new chemistries that has come in are very effective. They have shown and demonstrated that they are contributing their quota. And if you are using any vector control, particularly in the mosquito net or doing indoor residual spraying, I'm sure Syngenta and Mitsui will tell you that before a chemistry comes in, it's been in the pipeline for over 10 years. It means the tools that come in takes a long time, takes a lot, and resources. They don't easily come in. So what can we do? Let's optimize the tools that are currently available. What tool can be used where based on data? I know there's indoor residual spraying. I know there are nets because that's our main area. I know outdoor biting is an issue. I've seen someone looking at me. I know outdoor biting is an issue. IVCC had thrown out a call for proposal for new tools to see how this can be addressed. Whilst we look at the scientific component of it, my challenge to you as researchers again, how can we look at operational efficiencies that when these tools come in, they are within the budget of countries? And I'm saying this because we know what is happening in the global world now. Somebody just sneezed, and the continent is what is in trouble. I think for me, I see that as an opportunity for us to wake up and look within the resources we have and save the lives that have been lost. When it was COVID, everybody was crying all over. We came together as a country. But the data tells you that malaria is killing more people than COVID. Why are we silent on that? We know that we can do it. So I want to challenge Pamca-Gh Ghana to take the lead whilst you look at new chemistries, whether it's effective, if not effective. If it is introduced into the market, let's just look at just the science. But can we have operational research to say that these tools that are coming in can be integrated in existing structures? I've said this in so many countries. I was just coming from Uganda, came yesterday. And what Uganda is beginning to do is they've segmented and say that we want to do IRS but we don't have the money. What do? We introduce it in every boarding school, and we start it from a particular district to ensure that the pilot, the next level with the parents, when children are getting to school, they pay some amount of money to ensure that it's sustainable. Where nets can be used, let's use nets. Where IRS can be used, let's use IRS. And why they said that, they were introducing that is, in the boarding schools, net is not really ideal because they have bunk beds, and it's difficult to use it. What are we doing in Ghana? I know Ghana has done good efforts, and Ghana has started introducing 2 districts that I'm very much aware of, where government of Ghana is championing and funding it. I've said this on many global platforms, and I'm going to repeat it. As a Ghanaian, Ghana cannot eliminate malaria with donor funds. It has to be domestic resources. Once we have our own resources, we'll determine what tool to use where, and when the tools come in, we have the resources to ensure that we maximize the benefit of it. We have the private sector. I remember in one conversation, Prof. Binker's statement was, if you take Western region, look at all the mining companies that are there. It's not possible for them to pool resources together to eliminate malaria. The 20 agenda we have, 2030, to eliminate malaria, it is not feasible. I think it's a political talk, right? Where are we in what we want to do? Ghana has 21 districts to be able, where they are aiming towards fully elimination. Let's concentrate on that, but the domestic resources has to be mobilized. Christian is here. We're talking about the current strategic plan, which is over close to $3 billion. How much have we raised out of the $3 billion? But I'm sure if we look within, we will definitely be able to find those resources and deploy it to save the lives that are being lost. I wish to acknowledge that the NMEP has done extremely well. At least the number of lives that are being lost are being reduced. That is something that is great. We want to challenge everybody that this is many more good things to come. Don't worry about the number. The number is great because this is a start, and we'll continue to contribute our quota. And I want to acknowledge and thank all IVCC partners, particularly those who, Hawa, Tekeo, and your team who have traveled far too. It shows the commitment you have to vector control, and we wish to acknowledge the efforts that you are doing and contribute to your quota. On this note, I wish to thank everybody, and I'll still be around if there's any. I'm happy to take some questions later in the day within IVCC. Thank you very much, and have a wonderful day.
Thank you very much, Mr. Saibu. That was profound. He has thrown a challenge to us, a challenge that we have for ourselves already, but this is a reminder to embrace new chemistry, to be more innovative in our research outcomes, and to put it into translational interventions that would impact the life of the people that we're doing this for, ourselves and our families and everyone connected. Next on the list, we're going to have a brief address from Mr. Kofi Fume, who is the representative of the Health Alliance Network. And the Health Alliance Network is the representative of Vestergaard here in Ghana. Mr. Fume, you're welcome to give your remark.
Good morning. Let me take the easy route. I hear it said all protocols are observed. Then I don't have to go through the list. Yes, Health Alliance, we represent Vestergaard. Vestergaard produces permanent mosquito nets. We're happy this event is coming on today. There must always be a first, and if we really want to do it well, then the second will be an improvement on the first, the third will be an improvement on the second, and then on and on we go until it becomes a very big thing. So let's not be discouraged about today. It's just a beginning. For Vestigard and the Health Alliance, when scientific brains meet, we are happy. We are happy for two reasons. That it's an occasion to at least unearth some truths. It's not guesswork. When people like you come together and you put your brains together and you go through what you do so well, there's a high chance that what you come out is close to the truth. And when we know the truth and we use the truth, chances as we can move society forward. So when we see gatherings like this, we are happy and we want to encourage meetings like this. So as much as possible, do what you do best. Go through your scientific discussions. Get the data out, because the world is moving to a phase where it's not what I think, but it is what the data says. Okay? I may be thinking right, that probably, or the indication out in the market is that the users of my nets need some particular kind of net. But it must be confirmed by the data. And when it's confirmed by the data, I'm encouraged to move in a direction which I think is problem solving. So science and data have become very important for us. So do what you do. Get the science out, get the data out. Now the second thing that I believe we don't do too well is when we've gotten the science out and we've gotten the data, the extent to which we let the data influence our decisions. Particularly when we are relying on others. Mr. Saibu said it's time we start buying our own nets, right? It's the truth. But how soon would we start buying our own nets? We need to rely on donor partners for some time. Even if we want to buy our own nets, we need time to gather the money and create the budgets for the volume of nets that we are looking for. So for some, in the short time, we probably will rely on donors. To what extent do we allow the data that we have so much worked for and collected influence the decisions that we make or the donors make on our behalf? For us, those are our major concerns. But that should not make us shy away from doing the right thing. Let's continue collecting the data, because data arms us with the right arguments. When we have the right arguments, then we can assert ourselves in those relationships that are important for us in procuring or getting solutions to solve vector control problems. I would want to express our profound happiness in being involved in this conference. We look forward for more of such conferences, and we would be committed in ensuring that these conferences happen as regularly as you want them to happen. So enjoy your conference, and then let the data lead. Thank you very much.
Thank you very much, Mr. Fume. And I think we've all heard how we should be working together. We are not working in silos. There's the science, and in the core science, of which most of us are represented and actually actively involved. And there's a science in the chemistry that delivers the products that we use. It's more like a triad. So the science is there. The disease programs are also there because they are key stakeholders for what we do. We take the science, the disease programs, champion it. And there's also the community. And around the world and even around the sub-Saharan Africa, we know that malaria is a big problem. We have achieved many strides with the right leadership. And the right leadership is here. Dr. Keziamam, the program manager for the National Malaria Elimination Program. Please, don't hurry up. I have a lot to say about my boss. It's my boss. Allow me. A scientist herself, a public health consultant, and I'm actually tempted to say more, but it's okay. It's okay. Dr. Bob, thank you.
Thank you so much, Christian. My professor, Professor Kujokram, my teacher, who is the keynote speaker, Mr. Sylvester, representative of Mutual, the president, partners, colleagues, good morning to you all. Apologies for walking in late, and thanks for making it to be able to say a few words. And I'm very honored to be called upon to say something on the maiden conference of the Pamca Ghana. It's an honor, and it's so important to us. As Christian said, we manage malaria in the country, but one interesting, I don't know, I think we're in the process of coming out, and hopefully we'll come out a bit more. When last year, in the last part of the year, in addition to just dealing with malaria, our portfolio was increased to include other non-malaria diseases which are transmitted by vectors. So we had actually started some DEX review to see what is in the system, who are those working in the space. I mean, apart from the lymphatic filariasis, which has a program, all those other ones that didn't have a program, like dengue fever and all those ones were added to us. So you see that the conference is very important, and someone, I'm sure, for those of us who are not entomologists, yes, I'm not an entomologist, but until I came to the program, I'm sure I was wondering, why are we so interested in the mosquito, a small insect? But it's of interest because of the things that, the diseases that they are able to transmit. And they cause us a lot. Most of these diseases are in Africa. So I'm happy to see that there is Pamca Ghana. Pamca is an African organization, and we are working towards controlling the mosquito. A conference comes with presentations, you have books to read, you have seminars. I see a lot of young people here. I'm sure my professor will tell me the same thing, but I also see a lot of young people here now. So at the end of this conference, I'm hoping a number of things will happen. First, you learn. You hear about what others are doing, what diseases are there, what are the tools, what we can do. And I'm also hoping that you'll be able to share your experience if you are presenting, and you network. I had a professor who will always go to a conference, and by the time he's coming with something. He's either seeing something that somebody is doing and somebody you can do, or he's networked and he's created some connection that will give us money for us. So I'm hoping that this conference is not just going to be you walking in and going back, but you leave here with something, because our partners will support us. Mr. Saibu said it. Our partners will support us. Mitri will support us. Vexagas will support. But we have to make sure that we have to own the control of the diseases that the mosquito transmits, and make sure that we win. So as we come here, I'm hopeful that we'll go with some information. And burden things are good. You start from somewhere. I don't see the numbers as small. I was happy to walk in and see quite a number of people, because how many entomologists do we even have in the country? How many people are interested in mosquitoes? So it is a good start. So let's clap for ourselves. We've done well from coming today. And even though there's some transition, I think I can stand on Ghana Health Service platform and say that I'm sure the service is in a position to support the Pamca Ghana in any way possible to make sure that we can control the diseases that the mosquito transmits. When it comes to capacity building, we are happy to work with you to build the capacity and of people in terms of fighting this mosquito. Sometimes we get people passing through our institutions for internship or for some rotation to see what's happening. We are with you, Pamca. And we do wish you a very successful Maiden conference. Let's keep up the work. Make sure that this conference, you leave this conference with something. Leave this conference with something. Work, let it be the beginning of something in your career, in your fight against any disease. As we are sitting here, I always tell my people, you can be a driver, you can be a secretary, but whatever you are doing, just remember you are saving a life. So do it and do it well, so that you would save a life in one way or the other. Thank you very much and have a good conference.
Thank you very much, Dr. Mam. Again, thank you, all of us. Let's give ourselves another round of applause. As scientists, we are being thought of as too serious. Today, let's prove that we are not too serious. And we can still get the science done and also be relaxed. I see some people are, please, let's relax. And to help us relax, we would ask the media to give us a few rounds of music. Just stand up, say hi, turn to your left, to your right. Just say hi to someone. You never know. Here is where the connections are being. Meet your PI, you might meet your collaborator or someone. In the next 2 minutes, just stand up, say hi to someone. Don't go to the usual people. Some people, you don't know me, come and say hi to me. Me too, I want to know you. So let the media team give us just 1 or 2 songs.
Ladies and gentlemen, hello, ladies and gentlemen. As you fraternize, if you are seated in the back, please move forward.
I'm the one who said we should fraternize, but it looks like some people are enjoying it too much. It's okay. Can we all settle?
I don't know you.
Please,
Do you know me?
All right. Let's settle, please. All right, so while we settle, as a part of, can we settle, please? You are making me regret. So I had some other packages for you. Now, I will reconsider. All right, please settle. So while we are here and getting settled, if you are to have your poster up today and in the next session, kindly walk out quietly and then go and get your posters up. The booth is ready for us. So please, if you have a poster session, we also don't want you to exit the room, the whole team. One person. Right, please, let's settle. We settle.
We're getting there. Thank you.
Okay. I think we are there now. And they got quiet. Good. Meaning we are on serious business. The next one is actually a serious one. We have a keynote speaker ready for us. I would actually love that the president introduces our keynote speaker. A lot I can say, but we can actually hear a few words from the president to introduce our keynote speaker. Prof.
All right. Thank you very much. So we have the keynote speaker that is supposed to be delivered by a colleague. But I know Prof. Cram very well, so I think I should be able to introduce him at any point in time. So Professor Kwejo Ansakuram is a distinguished professor, and he has done a lot in malaria when it comes to research. He was the former director of Noguchi Memorial Institute for Medical Research, and his work spans in the area of epidemiology. He's been involved in a lot of clinical trials when it comes to malaria, and when it comes to identifying drugs to support malaria treatment. He's also been involved in vector control in collaboration with other entomologists. And you can mention his work with the late Professor Maxwell Apau. And he's also worked with Professor Boache and Professor Dazi in the area of vector control. And he's done a lot of teaching. He taught at the School of Public Health. I'm sure he's still teaching there, and even at the medical center, teaching a lot of medical doctors. So he's been involved in teaching, research, and a lot of work that spans in vector control. So with a round of applause, at the moment, shall we invite our keynote speaker, Professor Kwejo Ansakuram. Thank you very much. Thank you very much. Prof, you're welcome. Thank you for honoring the invitation.
So, thank you very much, and good morning. I was sitting down and wondering what the protocol is until my able student, unfortunately she had to leave, did mention a few things. So, Sylvester, the chair, the president of the association, invited guests, ladies and gentlemen, thank you very much for this invitation. Thank you very much for the invitation, and congratulations to the organizers. In fact, before we started, I was having a chat with my senior colleague Fred that this is quite impressive to see a room full of ladies and gentlemen interested in entomology. And we're reminiscing on the earlier times when we started studies and we're struggling to find entomologists and parasitologists to do malaria work. This was several years ago. So this is very, very encouraging. And thanks for the local chapter, Pamca, for putting this together. The other thing which also gives me hope is that the average age in the room is quite, what I'll say, probably less than half of for that of some of us. So that the things that you have to do, or we have to do as a country, I think we still have hope to be able to do that. And I'll also say thank you to my good friend, where is she hiding? Jiwalna, who, despite my kicking and screaming and everything, decided that I still have to do this morning. she wouldn't take no for an answer. And Joella, thanks. He gave me a young, able person, Mr. Festus Anim, who helped me with some of the background work to this. And so I'm going to talk about effective vector control and disease elimination in the country. In fact, the title I gave was Effective Vector Control and Disease Elimination in Ghana. Again, I arrived at that with the help of Joella because she wanted effective to be in the title by all means. But the question which came to mind when I was considering this was really, is it a question of just mosquitoes, seeing that my work has been in malaria? But she said, well, vector control, and I also said, well, there are quite a lot of vector-borne diseases and things. So what I try to do is to have an overview of vector-borne diseases. I won't prefer us to know all about all the vectors, but I'll mention them, look at some of the major ones which contribute to most of the diseases or the majority of diseases in country and also worldwide. Look at some of the current control strategies and also bring together at the end some of the harnessing that we need to do to be able to push this towards disease elimination. So, okay. Good. No, it's all right. I'll use the thing. So, the problem that we have on our hand is that despite significant advances in technology over the past couple of centuries, which led to improvements in health of societies, the recent dawn of gene therapy and other technologies, which give us a glimpse or hope at a bright future, that we may be able to conquer most diseases, we still have issues with rapid urbanization, climatic change, environmental degradation, increased global trouble, and other things which are putting us at risk of vector-borne diseases and vector-borne diseases, major formidable threats to the health of societies worldwide. According to the WHO, the vector-borne diseases are a significant drawback of efforts to improve health. And according to the WHO, 80% of the global population is at risk of vector-borne diseases. Almost 20% of the global burden of communicable diseases is due to vector-borne, one or the other vector-borne diseases. It causes approximately 700,000 deaths each year. But when you look at this on a global scale, you say, okay, it's a lot of things. But most of this stats that I'm providing actually occur in endemic countries in Africa. So it is our problem, and as has been mentioned earlier, it is for us to solve. So the burden falls disproportionately on the less developed parts, and including Ghana, and then even in our societies, the poor and the marginalized who lack access to basic amenities and other preventive or control tools. The vector-borne diseases will include malaria, which has been mentioned, lymphatic fluorescence, dengue fever. Chagas is not here, but it's a big case in South America. This has been a bane for us for a long time. Recently, we've had issues with cutaneous leishmaniasis in parts of the country, Volta region, OT region, which we're still struggling with. And then we have issues with chikungunya virus, Zika virus disease, which was an outbreak a few years ago. Yellow fever from Aedes and other things that the students will remember, Japanese encephalitis. And also, we shouldn't forget about schistosomiasis being transmitted by aquatic snails. There are other minor things which I haven't mentioned, like tick-borne fever, rickettsia, and other things. So you see that this is a huge issue which drains on the health of the populations worldwide. The majority of these are influenced by socio-demographic and environmental factors such as poor planning, as I've mentioned, lack of potable water, which will then lead people to get into water contact activities with infected waters, poor housing, and then also rapid increases and changes in land use patterns. So we are more and more less impinging on areas that the vectors were happy staying there by themselves, and then we get in their way and they live, and then invariably cause problems for us. On a wider scale, we have wars and other displacements which have also caused a lot of things. And one of the things we should remember is also increased globalization and trade. And this brings to mind the recent introduction of ADs, Anopheles stimuli, into the country, into the African region, and also into the country. The graphic I have on the screen is what most of us who have gone through epidemiology would see as the triad of infectious diseases. And vector-borne diseases are actually what I term they epitomize a classic epidemiology triad of host, agents, and environment interactions that give rise to disease. This is what we all learn in the Epi 101. I believe the interaction was not meant to be detrimental to man as the host, as we all want to enjoy the beautiful space here on Earth with the vectors and all the others. But somehow we do not usually stay on our own, but as I've mentioned, land use, expansions and things, we stray into other places which are habited by the vectors, and we then become infected in some way or the other, sometimes with very fatal consequences. Even in situations where the interaction does not lead to fatal consequences, the ensuing morbidity, usually chronic, long-lasting infections, result in huge economic losses, and for those affected individuals performing below their best, and sometimes throughout their lives. You could look at lymphatic filariasis, for example. People cannot even walk and they are bound. In other situations, others will have to stop work and care for others, and we lose life. As I've mentioned, in Ghana, the major vector-borne diseases are malaria, onchocerciasis, lymphatic filariasis, cutaneous leishmaniasis, and schistosomiasis. Dengue fever has been reported. Tick-borne fevers and things are being investigated by others, and we need to look at that. So what's the case for vector control at all? We've noted that about 1 in 5 of communicable diseases do occur as a result of vector-borne diseases. The problem is compounded by increasing population growth, rapid urbanization, poor urban planning, such that 80% of the population is at risk of one or the other major vector-borne diseases. This chart shows a composite distribution of the major vector-borne diseases, which shows the deeper the color, the more vector-borne diseases that we're at risk that we have. And it reflects all locations where the population is at risk of at least one of the following: malaria, lymphatic filariasis, dengue, leash, yellow fever, human African trypanosomiasis, onchocerciasis that I mentioned earlier. So the risk of infection for certain viral pathogens is particularly high in towns and cities where Aedes and Culex mosquitoes proliferate. And that's why I keep on about unplanned urbanization, because if we don't build our urban spaces properly, we make room for them, habitats appropriate for their breeding, and then we get exposed to that and we get into problems. The economic costs at both national and individual household levels is really high from caring for this. Apart from out-of-pocket costs for a particular infection, we've seen loss of economic activities, sometimes people having to stop work by looking after others, and in the time of the Uncle's Classes programs, a classic picture of the young child leading the adult person who is blind comes to mind. So the interactions that we're talking about, basic interactions, is actually becoming more and more complex as environmental factors and climatic change are intense. And so when that happens, we get extension of seasonal transmission, geographic transmission also is expanded, so areas which were hitherto free also become at risk. This, I'm not sure, okay, it's quite clear, okay. But this is the major vectors and the major diseases. If you look at the second column, we have a lot of diseases there, and we have mosquitoes, black flies, sandflies, the triatomine bugs, ticks, chicha flies, aquatic snails, and other ones for things like Rift Valley fever, onyonyon, and all those Crimean Congo hemorrhagic fever, and all those things which cause a lot of problems for us. I was quite thrilled to hear that somehow the country is considering mosquito control and not just vector control for malaria, because it was one of the things which preparing for this came to mind and said we should really have an integrated approach to this, because if we did that, which for the older ones among us will probably remember, there was actually mosquito control, and people will come to your house, the environmental workers or hygiene people will come to your house and check for Aedes larvae in your stored water and everything. And I remember growing up, my grandmother would always say, they're coming this morning and just empty all the barrels. You don't want any problems, just empty the barrels. Because they were usually red and something. I think it was red larvae and something else. Just one of that and you'll be fined or something. And she didn't want anything like that. So the days that they're coming for those examinations, everything has to be poured down. Just clear it. And it worked, because when you pour down, the larvae would die. They don't have any more water and things. But what it meant was that with the young ones, you have to go and fetch more water. So I was quite thrilled to hear about plans to actually have mosquito control, and I think that will really take us a long while. The basic thing for an effective vector control is that if we do not get bitten by the vector, or we do not get interacting with the vector, we are not going to get the disease. That is easier said than done. So don't be bitten by a mosquito, you will not have malaria, you won't have all the other diseases that they do bring about. So when we taught life cycles in schools, for example, I'm looking back, and it was never really an activity towards maintaining health. So it was all, okay, this is a life cycle for this parasite, and you have it done, and you put it out, and you get your marks, and you are great. But if we had a situation where this is done at a level where we realize it's for our health, so that as we grow, as we live, as we raise our families, we inculcate this along the line, we will have a more effective vector control program than anything that we can put together. And it will surprise you to learn that the Ghana Education Service, one of the objectives of the science curriculum actually is to know about common communicable diseases and how to prevent them to lead a healthy life. And I look back and say, how do we do that? Because those of you who've gone through JSS, I don't know how many of the life cycles at all you were introduced to. But they have this in their book as part of the objectives of the curriculum. So if we pull things together, which we are required to do or which we plan to do, I think we will end up doing quite a good job for controlling vector-borne diseases. So how do we tackle all these things with some good program or some well thought out program? This is to show the economic gains from vector control. So current strategies, what we've been able to achieve. I think this one is for malaria. Total cases averted attributable to IRS, which is the top shaded here. ITNs is the deep down here. Cases averted due to IRNS. And I know the ACTs is the one on top. And so if you look at the vector control activities, there's almost half of that. This was up to 2015. So vector control really pushes into the things. For malaria, which is what I know a bit more, it's been estimated that approximately 660 million cases were averted between 2000 and 2015 as a result of increased coverage of ITN and LNNs alone. $900 million was saved in case management, and the decline in malaria-specific mortality contributed about 12% of the rise in life expectancy that was seen in sub-Saharan Africa over that period of time. The economic value of that is about $1,810 billion to Sub-Saharan Africa, and the estimated return on investment is about 60 to 1. So the case for a good, well lined out vector control is there to be made, and I think we should do the advocacy more often. So what are the current control strategies? I'm just looking at what are 10. I think there are 4 of them that I looked at. There are others which we need to do, but we don't have the time to go through all of them. So if we look at mosquitoes, I'm just looking at mosquitoes. Okay, this is also another one of the estimated total economic benefit from productivity loss averted for lymphatic filariasis between 2011 to 2020 in blue, and 2021 estimated for 2021 to 2030 for LF, for schisto, and for onco. Onco is a little bit low because the date we are looking at, most of the onco has been controlled by the Onchocerciasis Control Program in the 70s and the 80s. So that's why the bars are low for onco. But even that is also still huge for what is left that we need to deal with. Yeah, so current control strategies for mosquitoes. This is what a group like this I'm very excited about, because on the average, especially when we're talking about malaria control, for example, vectors and things, control the mosquitoes. There's so many of them which give us problems. So if we're going to have a program that is going to control the mosquitoes for all those mosquito-transmitted diseases, we need to know who they are, what they are, and things. I try to capture the Culex mosquito, Aedes mosquito, and Anopheles mosquito. So these are only 3 of them which give us problems. There are others but these are the 3 major ones which will give us the problems. The current control strategies ITNs, LLMs, IRS, some environmental management for lava source control. The issues of urban planning, improved housing, house screening, we could do a lot. Vestergaard, we had some early work with insecticide wall linings and things like that, but it was never really continued, and I've always wondered why we didn't push that. One of the very interesting things which was done here by my colleague was Prof. Wachi, was actually, I think they were working in somewhere in Central Region, where we sealed off the eaves, because that's where the mosquitoes fly in and go into the thing, so your doors and things. And sealing off, there was more than 80% reduction of the mosquito abundance in rooms. And this is a simple improvement in housing in our rural villages, which we can do. And then also use of interesting, more effective repellents when we're out, especially now that you were talking about outdoor biting and things. We need to get out to go and work for economic activity and things. So we need to explore how we'll be able to do this. The ones that we use are the top 4 mainly, and beyond that, very little is being done in terms of getting really effective about other things. But some of the ones we're not doing are also those that will give us the long-lasting, effective outcomes that we need. So if we look at what we've been doing for mosquito control, which was largely malaria vector control for Anopheles, it was underpinned by the discovery by Ross. It's 19th century when he discovered the life cycle of the mosquito, and then on the back of that, all the hopes of controlling the mosquito vector with DDT and others, which led to the malaria elimination programs in the late 50s of the 20th century. But then the excitement and the optimism at the launch of the program of the 20th century was testament to that strategy, that we know the life cycle, we break the life cycle, and we are fine. However, that soon gave way to despondency when we realized that the task was not as easy as that. Because, number one, even the insect is so tiny, we don't always see that. And as Fred and I have sometimes mused about, we talk about capturing mosquitoes. So what proportion do we have to capture for it to be effective? And the problem is that maybe for us epidemiologists, we think about numbers. We are zooming into a space where we don't even know the totality of the thing. So we go and catch 5,000 mosquitoes when we're happy. What was the actual base that we're catching? So what proportion have we caught? And sometimes these things become, it's a bit of, you think you're making an academic argument, but it's not. Because in some of the studies which were done in Sudan, when I started working, I was talking to some of the collaborators there. The dry season in Sudan is very extensive, where you can hardly catch any mosquitoes at all. But come the rains, they still get malaria. So what is happening, and how are we going to be effective in trying to do this if we're going to pin everything on capturing the vector? But we need to do something. So we've seen the mainstay of our current control program. We've seen the huge reductions in numbers, the savings from IRS, from ITNs, which is very good. But this has been dependent on the use of insecticides, which comes with its attendant problems of resistance in the vector, environmental damage that we have to deal with. Earlier on, I had from IVCC new chemistries and things that we need to. We do need them, yes. But I would say that we have not done enough to research into local practices that have the potential to limit host vector interactions. And even when we have done so, that research has been mainly as a result of individual curiosity and brilliance hardly making it into the general population or our general programs where we need these most. One of the things which come to mind is that growing up again in my small village, my grandfather had a particular shrub which was grown around the house to ward off mosquitoes. So it was a hedge around the house everywhere, and you will always make sure that this is kept and things. I'm not sure, we never really did any things about whether it worked or not, but I think there was some to this because he was not the only one who grew this plant. And in the town, you will see that as a hedge for almost every household that you went into. Sadly, I've lost that knowledge. I don't think I can even recognize that plant. Another area of housing improvement is the covering the eaves that the data we have in the institute is available to be exploited. As I mentioned, it was done by Professor Boachi in, I think, Ochirikun, or one of those areas in Central Region, which showed conclusively that such minor improvements in house construction as sealing of eaves results in marked reduction in vector abundance in the dwelling places. I find this as a defect in our training as a whole, in that here we are scientists, medical people, and things who are doing this. Houses are being built by architects and engineers, but I don't know how much of these things get into their baselines and their planning for putting up a house either in the village or even in the urban areas. In fact, I've always argued with my architect and engineering friends that the issue of vector control, especially for malaria, it is not for us, the doctors and health workers, to do. It's their challenge because they have to build a house where mosquitoes don't survive or mosquitoes can't enter, so that as we spend our time in dwelling places and things, there's no mosquito to bite you if this mosquito is not there. It's usually laughed at, but I must say that I have one friend who has been doing a lot of rural housing, which is taking up the challenge. I haven't spoken to him for a while now, but he really also said, well, this is something we need to do. So as a country, if we want to be effective in mosquito control, we need to look at these issues and actually expand the people who need to do that. And I like the theme of the conference across board, from academia, research institutions, public and private and things. We need to stretch beyond our confines to bring all the others on board to control the mosquitoes. The next one I looked at was black flies. Let me see. The next one I looked at is black flies, which are responsible for onchocerciasis. Again, this is the life cycle. The breeding places we know to be the riverine areas with fast-flowing areas where they would lay their eggs. Larviciding has been very effective, and over the years, the onchocerciasis control program has done that quite well in the savanna areas and sprayed regularly and reduced the problem of onchocerciasis to the extent that lands and things have been reclaimed. What is left for us, as we saw from the economic gains chart, is a small amount which we still need to deal with. And this comes from what we've realized as the savanna version of the vector. And where that one has been adapted, the forest area, is such that we can't do the area spraying that was done in the savanna. The savanna is dry. During the dry season, you can fly, see every riverbed. You can zone in there and just spray your insecticide and go away. If you fly over to our forest, you are not going to see the ground. So if you do any attempt there, you're just going to waste your insecticide. So we have to use other methods, and some studies in, I think, Cameroon have actually gone to the sides and slashing and clearing the riverine areas, and also repellents. I put repellents here because a few years ago, we got in touch with one manufacturer in Canada who was doing some chemistries and things and has come up with this repellent for, in fact, he was putting that for mosquitoes as an anti, mosquito repellent. But it was at the time they were doing the Bui Dam and they were having problems with a lot of house flies for the workers. So we decided to test this there and give it to the workers to use. And it had a long-lasting effect. They could go to work for about 8 hours, 9 hours, 10 hours when they smear this in the morning, and the flies will not bite them. And the thing was called No More. Unfortunately, the program, the construction company got used it. They built the dam and then they left. But this is something that I think, again, should be exploited, and the issue about harnessing what is available between the research institutions, academia, private sector, and things come to mind, especially for this particular activity. Going forward, in the forest areas and things, we need to look at how we can use reduced volume of insecticides and things. And I think BTI, there have new formulations and things which allow us to use less volumes, which also stay for a long time. And especially for disease elimination, we need also to then also tackle the microfilary in the host. The next one I looked at is sunflies, and basically what is available to us is IRS, ITNs, LNNINs, durable wall linings, repellents, improved housing will all work for sunflies, but we need to also understand their life cycle very well, because if you look at the chart here, they have a cycle in other mammals, rodents, apes, and it's been one of the things which has hampered our activities on trying to find the transmission transmission areas or the transmission cycle in the Volta and Oti regions that we've been working at. But again, as I said, I get a lot of hope seeing the young people all interested in this, and this is one of the areas that currently we have people working on to try to get things working at. For us in Ghana, the second part of this chart is important because whilst traditionally or historically the phlebotomous species have been seen or recognized as the potential vectors of leishmaniasis, the work that we've done in Volta region and Oti region showed Segentumia, which is slightly different or behaves slightly different from phlebotomous, as the vector for the outbreaks that we've seen in that region. And that brings to mind the importance of household pets, rodents, and things that we have to consider in the control of the sunflies. The last group that I'll look at, or the last I'll look at, is the aquatic snails for schisto. Again, very complex life cycle that we need to deal with, and we're trying to tackle the snails here. So in all these vector-borne diseases, our understanding of the life cycle is very important. What have we done to the snails? We've got molluscicides, again, bringing in chemistries and things to control them. One of the things is niclosamide, something, I've forgotten the name, something green, Paris green or something, which we used to treat the water places with. But we can look at biological control, where we can put in predatory fish species to feed off the snails. This has to be carefully done, because sometimes when we get into an ecological area like this and we think, okay, we've got a good thing, we put in the fish, they take off the snails, and then the fish become kings and of their own, and nothing is feeding on the fishes, and it becomes another problem we may have to deal with. So we need to monitor these things very well. We should also look at plant extracts. Again, indigenous knowledge is very key that we should be able to look at that. Environmental management can help us by looking at the habitat modification, eliminating the breeding sites, and also planning our built environment such that we avoid the water contact activities. So we have to either pipe the water into the homes or at least get them water, which prevents people from getting into infected water. And then hygiene, and above all, bring the community on board. For disease elimination, currently we have MDA, which is the main activity that is being done. But we see that if we don't incorporate all these things, we may not be able to make much headway. So, this leads me to consider what I term integrated vector management. And from the foregoing, we see that there are several ways we can control all the vectors, all that I've discussed. But what is being done are one or two of the activities, but it's very important that we bring things together and push as much as we can on all fronts. So for mosquitoes, for example, we should both target the adult mosquito and the larvae. And targeting the larvae, we have to look at environmental management, using insecticides to reduce the breeding size, biological control, and community participation to keep things clean, the houses, no storage water and things like that. And that's for the larvae. And also targeting the adult mosquitoes, we should look at aerial adulticides. In some places, they do actually screen or spray large swaths of breeding areas. I do remember during my master's program in New Orleans, which is a city adjacent to the marshes of the Mississippi River. The bayous is full of mosquitoes. The New Orleans Mosquito Control Program, or the New Orleans Mosquito Control Board or something, when we visited them, was an eye-opener. They actually had the helicopters for spraying and daily monitoring of mosquitoes. So they're catching mosquitoes, and they had the geographic, right now the GIS will help you very well. But then they had the maps, and I've forgotten which latitude. If they caught one mosquito above that latitude, the planes took off. That was all there is to it. They just spray the mosquitoes, stay there, don't come. So depending on how much we have and what we can do, there's a lot that we can do. Also working in Gambia for my PhD and doing my survey on severe malaria, what I realized was that, again, for Banjul, the malaria case season was clearly, you could map when it starts, that the first cases were those who were living near the marshes of the river. And I remember discussing this with the malaria control program and said, if they had a program which targeted that, so before the rain starts, you are there to keep the mosquitoes and things, you will have a very good program. I don't know how much they took of that, but it was very, very classic. The very first cases that you see when you visited the house, because I had to visit all my cases, I have to visit their homes to check the house construction and everything. And you could see from April, May, as things go on before you come to Serekunda and things like that. So it was really something which I was quite, not excited, but I mean quite an eye-opener to me. Which brings to mind a very good surveillance program for all these things that we're talking about. we cannot do an effective vector control if we do not have a very good surveillance and monitoring program. So for our push towards elimination, require serious integration, adoption of additional or less popular but law, such as house improvements, sealing of eaves, and actually taking on board serious things about how the built environment is all done. To be effective and have strategies which are long-lasting and sustainable, it has to be underpinned by solid evidence. In a country with scarce resources, strong consideration should be given to an establishment of an overall vector control program. And as I said, I was very excited to hear that talk has begun of actually having a mosquito control activity rather than just the vector control for malaria, because that will help us to exploit the synergies across board to make a more efficient use of scarce resources than obtains presently. Whatever programs that are arrived at should be based on a strong local knowledge of all aspects of the pathogen vector host interaction, underpinned by a solid research both at the bench and in the field. Is the bench or the basic research that will give rise to the new chemistries and also an understanding of local indigenous knowledge in terms of the plants and other bioavailable things that we can use. And also the field adapted work in terms of how to deploy anything that we find will also be important. The new developments in molecular biology, genomics should be exploited as we look for new tools against all stages of the vector, both the larvae, the flies, and maybe even sometimes the PP, because although it's silent, that is what will give rise to the adulting. And if we can find where they prepare and things and clear them off, maybe we'll do well. Adult behaviors and things like that are all important. And as I hope a program like APP is not stopped and it will continue, so that we will get a lot more people looking at various cases. And as we drive this, we should not forget other disease vectors such as the aquatic snails, as I mentioned. And as mentioned already also, I'm quite hopeful because of the large army of science graduates and things that we have. And indeed, all graduates, because it should not be segmented and said this is an activity for science students or it's an activity for them. The anthropologists, for example, can help us to bring out all the indigenous knowledge that exists for us to exploit. And data scientists should be able to exploit, put together the surveillance and monitoring data to be an integral part of any control program, so that data analysis is concurrent and exploited to help us respond quickly and almost in real time to changes that which are bound to come. For example, change in the vector susceptibility and things like that. We should be very up and quickly respond to that. To be able to do all that, I borrowed this from the WHO Global Vector Response, which was put out about, I think, 2016 or 2017. And for an effective, locally adapted, sustainable program, we need the baseline I mentioned about intersectoral. We need a foundation of research, applied tools, applied research, and then also trained entomologists. We need a lot of people to be able to do this. We need people who would identify and says this is Culex, this is Anopheles, this is Aedes, so that when we're doing a combined or a coordinated program, we know what we have to look out for, because we may have a program which we think we're fine because cases have reduced on, say, malaria, but then people will still complain that they are being bitten by mosquitoes, and actually other conditions may appear, and we may still have fevers, because most of these will present as fevers, and we need to be aware of these and look at them very well. So we need a very good base of well-trained and skilled people doing very good research to give us the knowledge we need. And then at the operational level, we need collaboration, we need to engage the communities, enhance the surveillance and monitoring, as I mentioned, should be a critical, integral part of the program that we'll put up. And also, at least scale up all the current strategies that we know work, because we've shown that they do have good effects. So the opportunities for us to do that, I've mentioned already environmental and urban planning to build and drive out the vectors, scaling up on the proven and sustainable vector control measures, optimization and collaborations across all fields. We should exploit local knowledge. We should innovate, use the new technologies to innovate and develop new tools and interventions. And I brought in data science. We have to exploit the current advances in ICT systems to integrate all the several data sets. So somebody has data on mosquito abundance, somebody has disease and things. We should be able to bring this together to make the case, if nothing at all, to continue what we're doing so that we can improve the health of the population. There are challenges though, but I don't think they are not, they are insurmountable. We don't have the capacity. For example, I mentioned our challenge with having entomologists and parasitologists at the beginning several years ago when we started malaria work. It has improved, but I think we can do far better with what we have at the moment. The disease-specific programs should be synergized. They are not, the resources are limited, and we have to be able to bring them together so that if we have something which looks at mosquitoes as a whole, then that's fine. We have to get the data to provide the evidence for vector control, and changes in vector habit as a result of climatic changes, alteration in land use, etc., will all pose a problem for us. Increased globalization with mass movements of humans. Mass movement of goods, humans, recent introduction of Anopheles stevensii in Ghana, and I have political will and financial resources in capital, because we meet like this, we talk like this, but we need a concerted effort as a country to say that we're doing this, and it's only then that we can make impact on what we're doing. And we should not forget about the ethical issues, because some of the work that we're going to do, some of the things we're going to introduce will have implications, and we should be continuously monitoring all that. So I think I'm ending. In conclusion, vector-borne diseases are amount to substantial mortality and morbidity globally. There are proven interventions for the major diseases causing vectors, application of which has led to substantial reduction in disease incidence, and an effective control program will need to be grounded on solid research, trained and skilled workforce, strong monitoring and surveillance program, and above all, coordinated intersectoral collaboration. Although there are challenges to increase deployment of these effective control programs, political will and financing, for example, and they should be recognized and dealt with, there are opportunities for effective vector control that exist, and they should be exploited to accelerate the progress towards disease elimination, especially if we bring together the efforts scattered across academia, public and private institutions, and the like. Thank you very much.
Thank you very much, Prof. I think we can do another one. This has been very, very insightful, and it has been an honor. Thank you, Prof. Another one for honoring us among your many busy schedules. Thank you again, Prof. A speech like this makes you know that everyone is important, drawing from the last one. It's not only the science, but the political will, the community, and Prof has made us feel that we need to work together. Thank you very, very much. At this point, we are wrapping up the first session and would introduce our chairperson, who is yet to speak. He hasn't spoken much, but we'll invite him to give us the closing remarks. So let's invite Mr. Segbeya, who will crown it all up for us in this session.
All right, thank you, Chris. I'm not sure why you said I haven't spoken. Yeah, Prof said that I spoke plenty, so I'm not going to say much again. So I think Prof has set the tone for the conference. He's given us a broad overview of vector-borne diseases that we're dealing with. He's talked about the various approaches to managing them. He's spoken about the challenges we face. He's talking about innovations that we should be considering. He's talked about the resources we have and the resources we do not have, and how we should begin to think, well, though he did not use the expression outside the box, I think essentially that's what he was driving to. You know, one of the things I recall more than 10 years ago when we used to interact was when you used to talk extensively about why we are not doing mass drug administration. And today, as we're moving towards elimination of malaria in selected districts, I mean, it's exciting to see that, considering that on the vector front, there's so much to do. And I mean, my mind goes back to the charts you showed on the contribution of the various interventions to the reduction of the malaria burden in Ghana. And you can see that when you combine the various tools within the arsenal that we have to fight the various vector-borne diseases, and the particular example he gave was malaria, you notice the significant contribution the vector control interventions made to the overall reduction of the disease burden. So we are in good space, and again, I see the room has literally filled up. So we have a lot of young people, enthusiastic, passionate, eager to contribute their quota. And Andy, I'll come to your statement that yes, it's exciting to do the research. Many of us must begin to see how strongly we can enforce or enhance the bonding between the data, the innovation, the scientific research outputs that are coming with industry, development of new chemistry, new molecules, and all the other possible interventions that will help us deal with the vector challenges. So I won't attempt to summarize in any way, but I believe that the tone is set for today's conference, or well, the conference over the next 2.5 days. And I want to say that thank you so much, Prof, for this very detailed presentation. I believe that many of us would have noted some questions. I was like, oh, sometimes keynote addresses will need discussions, you know. But I believe that as we go into subsequent group presentations or plenaries, a lot of the questions will hinge around some of the points that Prof has raised, and it will be a good opportunity for all of us to discuss and pick up new ideas based on what people have researched, what people have observed in the field, what the implementers are finding, what the industry players and the private sector are bringing on board. So once again, thank you all very much, and I wish everybody a good rest of the conference. I'm told that we will be taking a group photograph. So Christian and Madam, you give us the details on what we'll do next. Thank you.
Thank you, everyone, and shall we give ourselves another round of applause? So at this juncture, I hereby close this session. The opening ceremony is hereby closed. And we're going to move out of this room momentarily. We'll go down the stairs and take a group photograph. After that, we have some refreshments for the coffee break. And because we're far behind on time, our coffee break is going to last about 30 minutes, and then we'll start coming back up here. We'll try to get here and get settled by 12:10 so that we can start the first scientific session very quickly and on time. Is that okay with everyone? Well, thank you all for the first session and the opening ceremony. of discussions or presentations on this sub-theme. For this sub-theme, we have our chairperson being Professor Michael Yao Osai, and he is the director of Binary GAEC. Professor Osai, can you please join me at the high table? Thank you. Co-chairing with Professor is Enyonam Ekia Akakli, and she is a research assistant at Vestergaard. She'll be joining Professor to chair the session. Enyonam, please come forward. We have our rapporteurs who will be at the back of the room taking notes, and we'll have my co-MC come forward and introduce the plenary speaker for the session.
Right. Thank you. So the plenary speaker for this session is Professor Yao Afrane. Can we acknowledge him and then give him a clap? I'm looking at him well and I'm being careful how to use him, but he's also my supervisor. So I have to be careful. But there's a lot we can say about Prof. Prof has done a lot. He has mentored many of us, and we actually have 12, if not 13 of Prof's students here. So thank you very much, Prof. And without saying much, that is it for my introduction of Prof. Prof. Thank you.
Good afternoon, everyone. I thank the organizers of Pamca-Gh Ghana for inviting me to talk here. I was so elated to know that despite the problems that is being faced by the parent Pamca, the Ghana chapter has really performed well and organizing this beautiful conference. Congratulations and kudos to you, all the organizers of this conference. Let's give them a clap. Without wasting time, I'm privileged to be talking to you today about strengthening vector surveillance systems to combat emerging mosquito-borne threats in Ghana. I must say that I'm no expert in this, and I'm just trying my best. My name is Yao Afrane. As I've been introduced, I am a professor of vector biology and parasitology in the Department of Medical Microbiology at the University of Ghana Medical School in this university. So first of all, let's look at the challenges in mosquito-borne disease transmission and control in Ghana. Some of the challenges that bedevils mosquito-borne transmission is rapid urbanization. This is a photo from Ghana. You've seen that a lot of buildings are springing up in Ghana. Many people are constructing. Many of you here, those who are well-to-do, are living in your own houses, not rented ones, and you are building every day. And most of you here who are young, very soon when you start earning big money, you are looking for land to build, isn't it? Yeah, so that is what is going on in Ghana. So that is one of the biggest issues. It's very good for us socially, but it creates opportunity for mosquitoes to breed. That could transmit disease. Again, we also have the daredevil that is there in this world everywhere. Changes in climate and climate variability, which is also happening. Let me also say that environmental changes is also a big factor, and would include the almighty galamsey that we don't talk about in public anymore because it can get political. That is also because it's introducing new chemicals into the system that could mediate insecticide resistance. So that is one aspect of the challenges of disease transmission and control. Another is that we are seeing increasing levels of urban malaria in Ghana. I did my master's maybe 20 years ago. KCCR people, let me see, I saw your car here. Let me see your hand. I used to be where you were many years ago, and I did my master's there, and I worked on urban malaria in Kumasi. Now, many years from there, urban malaria is increasing in Kumasi. Accra also, we did some work here. Now, 20 years later, it is increasing. There's so much transmission. If you go to the hospitals around, there is local transmission of malaria. So this is due to the fact that there's vegetable farming within the city. Look how beautiful it is. And so we say that the studies have shown that 95% of the vegetables we eat within the city is planted within the city. And because this farming is done in areas where there is the water table is very high. So when they dig holes like this, trenches like this, it is called a dugout well. Water seeps from the ground, and then they use that to irrigate the crops. And this creates opportunities for mosquitoes to breed. Another challenge is that increasingly we are seeing that the habitats within the city are getting more polluted, and mosquitoes are breeding in these habitats. You could see that this effluence from a bathroom and from kitchens, and this is where Anopheles mosquitoes, I'm not talking about Culex. If it is Culex, I won't show you this photo. But these are Anopheles mosquitoes. Anopheles mosquitoes is not also known to breed in buckets, but these are breeding habitats for buckets. And this is car tires over here, and we are seeing that mosquitoes are breeding in these car tires, and they are Anopheles culusae, not Anopheles stephensi or Aedes mosquitoes. So we even have measured the physical chemical parameters between polluted habitats and unpolluted habitats. And you see the dissolved oxygen is so low, but they still survive between the polluted habitats and the unpolluted habitats. Ammonium is so high. Look, 11.9 to almost like 5 with ammonium. That means that Culex should be breeding there, but we find so much Anopheles breeding in here. So adaptation to urbanization is also happening, and this is a big issue. Another is that invasive species that are also coming in. We've seen Anopheles stephensi. Everyone here knows about it. Our Aedes albopictus, which we thought was just not so much here. In Takoradi, there are so very many moving around everywhere. Okay, so that is also another species of Aedes that is coming in. And you know that right now, dengue is almost everywhere in Ghana. Something that we didn't think about 10 years ago. Okay, so these are challenges that is facing mosquito-borne diseases. The challenges doesn't end there. How for Aedes albopictus that I just showed you, we know that they are coming from the ports, because we've gone to the ports. My research group, based at the University of Ghana Medical School, has gone there to check, and there are a lot of them in the ports in Takoradi. But then, how did stephensi come in? Is it through area migration? And I'm showing you this photo from a work we did here in Ghana. My research group teamed up with a group in the NIH, National Institute of Health, to use this balloon. This is a helium balloon up here. And it's tied to a rope. If you can see, if you have very good eyes, you can see that there's a rope down here. And there's some panels that have been put there at 150, 200, 250, and 300 meters above the ground to collect mosquitoes that are windborne. And it is surprising that at that level, at that height, we could find mosquitoes that we captured. So no one knows whether this is how Anopheles stephensi came in. And we captured mosquitoes. We captured a lot of mosquitoes, some other insects. And these are also invasive insects. I don't work in economic entomology, but they have identified that those are invasive species to Ghana, and they are originally from South America. I don't know how they would fly all the way there here. Okay, are they from cargo planes or cargo ships bringing them? Is it bus travels that came from East Africa to here? We have no idea. This brings a big problem for disease surveillance. When I talk about insecticide resistance, anybody who works in insecticide resistance knows that the mosquitoes in Ghana, both Anophelines and Aedes, have all developed resistance to the previous 4 classes of insecticide, such that you have to bring in 2 additional ones to be able to combat them. And so phenotypically, everywhere you go, like MTN, you find them that the resistance is so high everywhere across Ghana. And there are so many mutations that is also causing these mosquitoes to become resistant. And if you look at the so-called KDR West, the knockdown resistance that is supposed to be from West Africa, they have almost reached fixation. They are in some communities, they are 100% in every mosquito. And this is what we are talking about. How can we control mosquitoes if they are resistant to the insecticide that is being used to control them? Another problem that I would like to talk about is that the vectors have adapted to the interventions that are being used. All the interventions are indoor based, and they are also based on insecticide. And therefore, this has allowed many of them to move outdoors. We knew many years ago that mosquitoes like Anopheles funestus, Anopheles gambi are indoor based. But now, if you are using insecticide indoors for IRS, indoor residual spraying, and bed nets, then they should move out. And this is what is happening, that almost everywhere, like this area in Dodowa, there are more mosquitoes outdoors than indoors. Okay, and we have also seen that they are changing their biting times. Look, this is HLC that we did from 6 p.m. until 6 a.m. And by the time you are finishing, you realize that the mosquito numbers are not even dropping. That is when the peak is coming. There's another peak. And recent studies have shown that they can even go up to 8 o'clock before coming down. So, meanwhile, that is not how Anopheles mosquitoes or malaria vectors should be behaving. And so these are challenges that is happening with mosquito-borne disease transmission and control. Therefore, there's need for enhanced surveillance, that we should move out of the ordinary situation and go to more sophisticated ways of trying to identify all the behavior so that we can control these vectors. This would include monitoring vector behavior and species spread. Where have they gone to? Anopheles arabiensis, for instance, moving away from the Sahel zone into the forest zone. Are they adapting? We can only do this if we enhance surveillance using more sophisticated methods. We should detect insecticide resistance and the mechanisms. And how did we not know that dengue is coming into Ghana until there was an outbreak? We should have forecasted this long time ago. And so we need to detect new pathogens and how they are spreading. Now that we are seeing new Aedes mosquitoes, that were not so many within the country, are we also monitoring that they are carrying pathogens, and where are they coming from, so that we can stop them at the ports? So the current system is inadequate to meet these needs, and therefore we need to do something about it and come up with new tools. So what are the new tools that we could use? We need next generation tools and technologies. I'm talking about geographical information systems and remote sensing. That we could go out there. Normally we do this, our surveillance with GPS in our hands, measuring, taking the GPS positions of where we find within habitats. But we use remote sensing also to be able to draw heat maps like this. That will show where the densities of the mosquitoes are, so that we don't have to waste so much resources doing indoor residual spraying everywhere. Okay, so right now, if you go to the north of Ghana, Agamal, I saw the person in charge of Agamal here, and they use so much money spraying many houses in the north of Ghana. So are the PMI people also doing the same, the Presidential Malaria Initiative of the US. They spend so much money going from house to house, village to village, spraying so many houses. Should they spray that amount of houses because they have the money? Or should we use next generation tools like GIS and remote sensing to know where to spray so that all the other areas could be affected? Because if we kill where the mosquitoes are concentrated, they will not fly to the other houses. Also, drone imagery. We can use drones to map the larval habitats. We do larval mapping, and I may not show you photos here, but there's most groups here do larval mapping. You know where all the mosquitoes are breeding. Do you think that that is all of it? Can we use larval source management to be able to eliminate the larvae? No, because there are places that we can't go. And to be frank, 2 weeks ago, we set some ovi traps in Tema, and one of my students told me that they didn't bring all the ovi traps. I asked them why. They said they hear that place we went to put, there's a lot of snakes there. That is very good. I don't blame them, because who would want to go to where snakes are? Okay, you don't want to go to where snakes are, but the drone is not afraid of snakes, are they? They can go. They will be up there and map everything for us, and they can strip the whole forest or wherever for you to see down wherever mosquitoes are potential habitats. And that is what I'm talking about. Okay, so we have to use drone imagery. Those of you who were in Pamca 3 years ago in Kigali, the last day I think there was a show of how they use their drones to undertake control. And I'm encouraging everyone that this is possible, that if Ghana, we can also do this. But all this boils down to one thing: money. Okay? And then when we collect all this data, we should be able to make some models to predict where mosquitoes will be abundant. That is disease modeling. That you could have some models and then be able to predict that this is where we think that at this time there is going to be a lot of mosquitoes. And so we should direct our focus there and apply our control methods rather than spread it across, because that is a lot of money. Now, USAID is gone, and PMI, those of you who work with PMI, you know that the funding is being withdrawn by what is happening in the US. So we need to cut our coat according to our body size, isn't it? And so that is what we need to do, that no matter how much money is available, we need to conserve it. And then let us not forget that we are not working in an island, and that we need to do all the surveillance together in a One Health approach, because there's going to be a spillover from animals to humans. Dengue is so much with the apes and the monkeys around, and that they could be, those that are biting these animals could transmit it. It's sylvatic transmission to humans. Okay, so this is very possible. So we can approach this with One Health in a One Health approach. Right now in the Americas, I'm talking about South and Central America, there's Oropouche virus. Those of you know about it. It's also a mosquito-borne disease that has spilled over to every community within there. And this is what will happen, that if we don't approach this within a One Health approach, things could get out of hand. So what are some of the challenges and gaps that can be improved? We need to train more people, not just people who can just go and collect mosquitoes with HLC and Procopax and aspirators. We need to train more people. We need to, this data that we are collecting also, how do we manage it? How do we store it? Where can we keep the data safely? This is very important, and what we use it for. These are some of the things. We need to be more sophisticated and use advanced methods, not just mere PCR, but also going on to sequence. And we are not doing this in Ghana, but a few of you have been sponsored to go and follow the, in the US, some of you were sponsored to go, I see a few of you here, to see what the mosquito districts are doing, that they are doing fogging. That is something that we don't do in Ghana. And that if you know that Usu has a lot of mosquito, this evening you go there, announce that tomorrow you are coming to spray, and then fog the whole area. This is something can be done. And then we need to integrate this into our health system. So Christian is here. He belongs to the National Malaria Elimination Program. That they take the data and integrate this into their systems. Okay. Now, let's call to action and look at the solutions. Okay. We have to invest in the people. We have to invest. So what we are doing is one of the investment, and train more people in sophisticated ways, genomics and bioinformatics, that they can use these pipelines and be able to do all the methods that I told you about. GIS training and remote sensing. We have to do this, One Health approach, to be able to sort this problem out. How do we, why is genomic surveillance important? It's very important because we are finding cryptic species all over. We are finding what is called introgression, that some of the mosquitoes are transferring their genes into other mosquitoes to make them more resistant. That is what is driving resistance. And we can only do this through genomic surveillance. And we need to train more people at that level, not just dissecting. I started my entomology doing dissection. These days, many of you don't do dissection because it's past and gone. Let us move forward like that and forge ahead. And integrate this into the health system, that the programs should be able to absorb the data we have and be able to inform what needs to be done, not doing the same thing across different ecological zones and in different areas. That is not, one size will not fit everyone here. Let us do that. Again, we need to be forecasting and undertaking early warning systems. This is very important, that to support evidence-based policy. Okay, so that we know that at this point we expect dengue outbreak in this area, and so we should be prepared that as soon as the numbers are going up, we start our spraying and all that. So that is very important. So in conclusion, I would say that vector adaptation and invasive species are coming. These are challenges. Urbanization, climate change are all in here. And the surveillance must evolve. We cannot use the old systems. We need to use new systems and to be strategic in our actions for vital, effective, and sustainable vector control. I will end here by acknowledging my funders who have helped me, NIH, even though some of the funds, one of them is suspended, I don't know when. The Bill and Melinda Gates Foundation, who have also supported me so much in the last 2 years. And my team, who have collected so much data for us to publish to get to this point. I thank everyone for listening to me. Thank you.
Thank you very much, Professor Afrani, for doing justice to the topic. We'll open up for 3 questions, and then we'll open up for 3 questions, and then beyond that, the discussion will continue during the lunch break. So if you have any question for Professor Afrani, we can take.
Right.
I was going to say that if you give a presentation and there's no questions, there are 2 things. Either you confuse the people or they understood you so well. Kindly mention your name and ask your question.
Okay. So I'm Augustine Suma from KCCR. So Prof, thank you for the excellent presentation. About the Anopheles stephensi that was identified at the high altitude. And I was glad you mentioned about the genomic surveillance and the need for, integrating in the health system. Was the stephensi identified through the genomic surveillance, or was it just PCR?
Thank you very much. So the Anopheles stephensi was not identified with a high altitude one. That was different. Those are different mosquitoes that were identified there. Anopheles stephensi was identified using genomic surveillance. Genomic surveillance. We have to sequence because at the time we didn't even know what it was. PCR did not show anything that it was Anopheles stephensi. We thought it was something else. But then it's genomic sequencing that identified it. Yeah, and the thing, the genome was deposited in the gene bank.
I think there's a question online. Can you read the question for us? Okay. Any other question? All right, thank you very much. So proceed.
Please, this one. Professor, thank you very much for your wonderful presentation. We've seen your leadership in this industry for quite a long time. I was intrigued to have seen the helium bulb and its association with sample collection of malaria vectors or mosquitoes. Please, were you saying that, so in terms of, are you trying to explain perhaps how Anopheles stephensi got to Ghana? Because we read some publications where they think they might have flown from somewhere, and different from Aedes, where their eggs will be in the ships, and others that can survive for a long time. So if you saw Anopheles in very high altitude, are you perhaps preempting that they can survive that height and then fly from those countries to Thank you very much.
Thank you very much, Dr. Kingsley Badu. As I indicated, please, this was not where we found Anopheles stephensi. Okay, this surveillance, I didn't even show results because they are still, I think we've sent the, it's in, how do you call it? What? Yes, we send it to Nature, but yeah, you could. Is it online yet? No. Okay, but we send it to Nature to publish, and so very soon you'll see the paper coming out. But now we found mosquitoes here, but not Anopheles stephensi. That was found in Accra. These were set up in Agogo and Wenchi, and so we saw mosquitoes at very high altitude, including 300 meters above the ground. Now, I put question marks because from this surveillance, we never saw any anopheline. We found anophelines, but not stephensi. And we don't know how they got up there. This work has been done in Kenya. It is published. So check Guyan's group. Harrison is the first author. And in Mali as well, similar things have been done. And they also saw mosquitoes at that altitude. Nobody knows how they go. If you have followed the mating of mosquitoes, sometimes when the females are fleeing from the swarms, they go up, and the males are chasing them. So it could be that wind blows them after that. I said it could be. I'm not saying that it is. I have no idea how mosquitoes should be flying up there like that. They are not aeroplanes. Okay. And so I don't know how it came about. When we found stephensi, we did the phylogenetic analysis and realized that it's closer to the one in Ethiopia. How it got here, whether it is by cargo plane, long-range area migration, or a cargo plane because planes fly from Ethiopia to here, and I'm not saying though, but I don't know any ship that comes from there. It could also be that they are coming from Asia directly here, okay? Or is it bus travel? I don't know. We all have to use the surveillance methods that I've talked about to be able to find out where stephensi came from in Ghana. Unfortunately, it is very difficult to find them. And so that is the problem, that we cannot do a lot of others. But what we found here, the phylogeny shows that they came in from, they are closer to the ones from Ethiopia. They are closer to the ones in Ethiopia when we did that. Please, read the paper. It's published from last year. Okay, and you can understand what I'm talking about. Thank you very much.
Thank you. Unrelated, there's a car key here. If you've lost your car key, we'll leave it at the back, and then you can pick it up later.
Thank you very much. And I think there's evidence of wind-assisted dispersal of mosquitoes, and there's a lot of literature on that as well. Thank you. We'll continue with the rest of the presentations, and usually plenary presenters have the liberty to go as much as they can, so long as we are within time. But for the rest of the presentations, we are going to stick to time. That is not to say that Prof went beyond his time. He worked specifically within his time. Less than 20 minutes, he was done. So the next presenter, I'll give the mic to my co-moderator to introduce the next presenter. But the ground rule is that when it's 5 minutes to time, end of your presentation, you would get a signal like this. It means that you have 5 minutes more, and then you try to wrap up your presentation. After each presentation, we will take a maximum of 3 questions, and the rest of the questions you can continue during the lunch break. Thank you.
Good afternoon, ladies and gentlemen. Our next presenter is in the person of Mr. Gabriel Akosai Brempong, presenting on the title, Entomological Survey in Highlands Agroecological Centers in Northern Ghana, reveal high malaria transmission for pyrethroid-resistant Anopheles fenestus population during the dry season. Mr. Gabriel Akosai, please, the floor is yours.
So while we wait, I just want to be sure that all our presenters are present. So, Equia Ohenewa Yurenshi-Dankwa. Are you okay? Then Michelle Asibasi. Okay. Linus Doty. And then Derek Ban Sakite. Okay. So we have all our presenters here. I'll be glad if you can come and sit here. So, in the front row. Those at the back, can you come and sit on the front row here? And have we all submitted our presentations to be uploaded?
The inconvenience. So my name is Gabriel, and together with my group, as has been highlighted earlier, we need to do a lot of surveillance to bring forth the data to back our decisions. So together with my team, we embark on a similar journey to survey for mosquitoes in Ghana. And so today I'll present to you the findings of that study that I've entitled Entomological Survey in an Agroecological Setting in Southern Ghana is revealing high malaria transmission from a pyrethroid-resistant Anopheles funestus population in the dry season. So this will be the outline for my talk. I'll give some introductory background to the study, the main objective of the study, and then the methods that we adopted and the findings, and finally we'll give some acknowledgements. Okay, so for the background, we say that the burden of malaria is highest in Africa, unfortunately, because over the years we've always been recording more than 90% of the infection, and also more than 90% of the mortalities related to the infection. Ghana is not an exception, and because we have these vectors that are very effective in transmitting the parasite that causes the disease, we focus mainly on using ITNs and then IRS to control these malaria vectors in efforts to reduce the transmission. But of concern is that we've realized there is a lot of insecticide resistance that has been developed by these vectors, which is derailing the effectiveness of these vector interventions, and then as a result, we don't see a lot of decline in the burden of the disease. And as such, we need to manage resistance, and that is why we need to survey local vector populations to monitor insecticide resistance in the vectors so that we'll be able to be proactive in managing the problem. So as you can see from this picture, Anopheles funestus is a major contributor of malaria transmission across Africa. But in Ghana, we have very limited studies that is pointing out to the contribution that it has in the malaria transmission. So we took it upon ourselves to survey around Ghana to get some data to back it up. Okay, so generally, the objective of the study was to characterize the insecticide resistance susceptibility pattern and assess the impact of the insecticide resistance on the control tools, and also investigate the mechanisms that is being employed by the vector in resistance mediation. So for the objective, our surveillance took us to a small community in Pamca-Gh that we call Onuku. As you can see from this picture, there's a picture of the community. So we collected indoor resting mosquitoes with Procopac, and then these were allowed to rest for some days, and then they were processed for egg laying in small tubes, and then transported to the lab for rearing, in situ rearing under standard in situ conditions. And then after they were emerged, we used 3 to 5 days old mosquitoes to do bioassays to profile their insecticide resistance, and then also we use some of them to assess the efficacy of some bird nets. And then also in terms of the molecular characterizations, we first of all had to identify the species composition of Anopheles funestus, given that it is a complex or a group of mosquitoes with similar morphological features. So we identified the species to the molecular level. And then we also use a probe-based PCR technique to detect parasite, Plasmodium parasite infections in the mosquitoes. And then finally, we have to genotype some key resistant markers that are mediating resistance to the mosquito population. So in terms of the results, the species composition, we realized that Anopheles funestus was the only major vector that is being present in the community. And then these were also transmitting a lot of malaria. As you can see from this photo, we have as much as about 16.1% of the mosquitoes that we selected for sporozoite infection, amplifying for Plasmodium falciparum, and then a little, just one of them was infected with Plasmodium malariae. And then on the left, this is the resistant profile of major resistant genes that are conferring resistance to the mosquito population. And as you can see, this mutation is very high in terms of its frequency in the population. We have about close to 55% of them being having the homozygote mutant, and then we have about 20% of them harboring the heterozygote, and then only just a few of them were susceptible to that mutation. And this mutation has been linked to pyrethroid resistance. And then also, when we see this CYP9, CSP9A markers were absent, because these are markers that are most of the time prevalent in Southern Africa populations. And then we also see this ACE1 mutation was absent in the population. And then we also have high frequency of the RDL resistant marker that is conferring most of the time resistance to deadrin and all that. And it was important that we know this, because now we are introducing the bruflanilide that is able to control most resistant populations. But when we see high levels of this marker that could potentially impact bruflanilide efficacy, then there is a cause for us to worry. Okay, so in terms of the phenotypic characterizations, we realize that most of the pyrethroids the mosquitoes were very resistant to most of the pyrethroids. We have more than 60% of the population surviving exposure to these pyrethroids. And as you can see, it's only pyrimidine methyl that was very effective, that all the mosquitoes were dead after exposure. And as we can see from this figure 2, we see that as pyrethroid resistance here was very high, we proceeded to do the intensity assays and realized even after exposure to 10 times of the diagnostic concentration of the insecticides, these mosquitoes were still surviving, with about close to 10% of them surviving almost all the pyrethroids. And then we perform synergist assays to predict whether there are metabolic resistant mechanism that is being employed in the resistance. And we realized there was a significant recovery of susceptibility to the pyrethroids when we pre-expose them to PBO. And that suggests that cytochrome P450s could be the major drivers of resistance in the population. And this went ahead to indicate that the PBO nets were the most effective in controlling this resistant population. As we can see, all the mosquitoes were dead to exposure from cone assays with PBO-based nets, Olicet Plus and Permetrate Top, whilst we have all the pyrethroid only nets having reduced efficacy. And so in conclusion, I would say that the study has documented the role that Anopheles funestus play in the transmission of malaria in Ghana. The infection was very high. 16% of sporozoite infection in the mosquito is quite high. And so that means that for some reason we don't have much information about the vector contribution of funestus in malaria transmission, but here we have some data confirming that it is a serious vector that needs to be controlled. And then we also have high intensity of pyrethroid resistance recorded in the population, which is leading to a drastic loss of efficacy of pyrethroid only nets. And then this aggravation of resistance could be driven by metabolic enzymes, and then inferring that PBO-based nets are very effective in controlling the mosquitoes. So this study highlights in-country variations in the insecticide susceptibility patterns, and that is why we need to upscale surveillance so that we will get data that will help us in effective deployment of vector interventions. I say that because we have some data from Obuasi area, and then when you look at the data, we compare to the data in Begro, we have significant variations in terms of the phenotypic resistance of these vectors. So that is why we need to do a lot of surveillance before we deploy these vector interventions that is available to us. So in conclusion, I would like to say thank you very much for your attention, and then I would like to say thank you to the malaria focal persons in the Pamca-Gh district. They helped us a lot when we went there to survey for mosquitoes, and also the people of the community, Oku, and then the assistants that help us in the surveillance. And then we also want to say a big thank you to the funders, Bill and Melinda Gates, supported this work, and then also finally to the colleagues of my institution, Binari, and then also CREATE in Cameroon. Thank you very much.
Thank you very much, Gabriel. So 3 quick questions for Gabriel. Any question? Yes?
Where's the question?
Gabriel, thank you very much for the presentation. On slide 8, I saw unidentified the Plasmodium species that you did you detect only Plasmodium falciparum and malaria, or you did for others? And what did you do with the unidentified samples?
Protocol has all the primers that are supposed to detect all the four major Plasmodium species. Okay, so what we have here is that we only identified 2 of the species that are causing malaria there. So that is why we have that. All the rest of the samples did not have any parasite infections.
So I think it's not unidentified, it's uninfected.
Uninfected, yes. Sorry.
Okay, here and then there. Now we can proceed. Please make it snappy because of time.
Okay, thank you, Gabriel, for your nice presentation. Recently, there was a paper from Kenya that's published that they detected the KDR genes in Anopheles funestus. I wanted to ask, from your study, did you try detecting KDR in your mosquitoes? Because if they also have the KDR gene, there's a high possibility through the introgression and other means they might be spreading it, and to be a major challenge.
Yes, thank you very much. So that KDR that was detected, even as of now, when you check, it is only restricted to the location where it was identified. Okay, so unfortunately, I did not pay attention to that, trying to screen for that mutation here. But what I would say is that for now, it is only restricted to, I think, Southern Africa, Tanzania, or somewhere here.
Thank you for the great work you're doing. You mentioned there's a marker which has implications for the profranilide. This will be very interesting, maybe quite a serious thing to look at. Can you throw a bit more light why you think that's a threat to the newly introduced insecticide? Thank you.
Okay, thank you very much, Doc, for the question. So this particular mutation is involved in dead ring resistance. And what we know is that the resistance there, the mutation affects the GABA receptor, which is also the main route by which the broflanonide also works. So if you have this high level there, and then with the idea of cross resistance and all that, then we could have a potential impact on it. So that's what I said.
Thank you, Mr. Gabriel, for your insightful presentation. Our next speaker is in the person of Ms. Ikia. Our next speaker is Ms. Ikia Obenewa Yuenchi Dankwa, presenting on maintaining pyrethroid resistance in semi-filled colony of Anopheles gambiae, red in tap water. Ms. Ikia, please, you have 15 minutes.
Good afternoon. My name is Ikia Obenewa Yuenchi Dankwa from the Vestergaard Noguchi Vector Lab. And today I'll be presenting on maintaining pyrethroid resistance in semi-filled colony of Anopheles SL red in tap water. So the use of vector control tools have helped in malaria transmission control over the years, but there is also the issue of insecticide resistance developing in colonies of mosquitoes. And this is by the deployment of insecticide-based tools like treated nets and IRS spraying. So in developing new insecticide control tools, there is the need to test the products with laboratory red mosquitoes that closely resemble the characteristics of wild populations. So the Pamca-Gh strain is a pyrethroid resistant strain that has been colonized at Vestergaard in 2022, and it's a pyrethroid resistant strain and a key model for bioefficacy testing in the lab. But the resistance of the colony is maintained by rearing the colony in filled water and also periodic addition of filled larvae. But this method may not be sustainable in the long term. This is also due to the cost of maintaining the colony, and there can be the issue of an outbreak that can cause destruction of breeding sites in the future. So to add up on the colonization in the field water, this project aims to check how to sustain the pyrethroid resistance whilst rearing the mosquitoes in tap water. Our objectives were to investigate the viability of maintaining the pyrethroid resistance in tap water for the Pamca-Gh strain, check for the time at which the resistance begins to decline, and then identify optimal intervals to introduce artificial selection by selecting them with the adults with pyrethroid insecticides. So for our methods, our baseline colony, the semi-filled colony, was profiled, then was read in tap and filled water. Then the adults from each generation we performed susceptibility tests. Then for fitness markers, we took wings for wing measurements. In the biomolecular lab, we checked for mutations, the KDR and the ACE1, and also identified metabolic enzyme activities within the generations. So for our results, our baseline colony F47 was initially profiled. Then we monitored the colony at each generation. So for the phenotypic resistance, we can see that the colony, both filled and tap water, they were resistant to pyrethroids alone when they were tested. But with the addition of PBO, a synergist that inhibits metabolic enzyme activity, you can see that for deltamethrin plus PBO and permethrin plus PBO, the percentage mortality increase. Even for the deltamethrin plus PBO, you can see we reached up to 100% for some of the colonies, which passed the WHO susceptibility criteria of less than 90% dead mosquitoes. We also checked for the KDR gene and ACE1 mutations in the mosquitoes. For the tap water, it was interesting to see that the KDR mutation increased over time, for it reaching a peak of 1 by the 10th generation and 11th generation. But for the field water red colony, the KDR mutation reduced rather to 0.66 by the 11th generation F58. But for the AC1 mutation, which was for organophosphates, we see a fluctuation, but it stays within the range of 0.5 and 0.6 for both treatments. We also conducted metabolic assays for the both colonies, and from our results, the beta recorded the highest activity. We screened for beta, alpha, mixed function oxidase, GST, and ACH. Beta recorded the highest activity, but by F53 we also seen an increase, but dropped by F56. For the other insecticide, they were similar compared to the baseline colony F47 with peaks at certain points of the generations. So for wing measurements, we took wing lengths to check for fitness of the mosquitoes, and we could see that the mosquitoes reared in tap water had larger wings compared to the ones reared in field water. So to conclude, rearing in tap water maintain the phenotypic and genotypic resistance from our current results, but the project is ongoing to monitor if there will be a decline in resistance over time, and with that we'll determine the best interval to select the adult mosquitoes with the pyrethroid-based insecticide. But for now, tap water rearing is a viable strategy to maintain resistance in the semi-field of the Berbia colony. So thank you to the Vestergaard Vector Lab team, and thank you for your attention. I'll be happy to take any questions.
Thank you, Ikria. Now we will take 3 questions from our audience.
Thank you so much for your presentation. My question is, the 2 groups that you had, were you feeding them?
They were red under lavatory.
I mean, were you adding feed to the larvae, the same amount of feed for both the tap water and the field water?
Yeah, it's the same conditions. They were red under the same conditions.
Okay.
Please, any other questions?
Thank you for your presentation. I wanted to ask, you said for the tap water bred mosquitoes, they had larger wings than those in the field.
Yeah.
So what could be the possible reason why tap water red mosquitoes have big, like broader wings than?
From research, you can see that field mosquitoes have smaller wings. There are research papers that see that mosquitoes from the field have smaller wings compared to the tap water. But it could be the controlled environment, so they are more comfortable compared to the ones in the field. So there's reduced natural selection and other factors that can contribute to them being bigger compared to the field water.
Thank you.
Thank you very much for the presentation. I wanted to ask, were you exposing both of the colonies to insecticides? That's for the selection. And what interval were you using? Were you exposing every generation or every other generation for the selection?
So we've not selected the colony yet. For the first part of the project, we were tracking to see if resistance will drop over time. And from our results, the resistance levels are within the range. We have a baseline from data collected from wearing the semi-field colony. So we have a baseline that will determine if there is a drop. And at that time, we will select, then see if the resistance level will increase.
All right, thank you very much, Akia. I will give her a hand. Coming up next is malaria vector surveillance across 30 sentinel sites for informed decision-making towards malaria elimination in Ghana, to be presented by Michelle Asibasi.
So my presentation, like Prof has already mentioned, is malaria vector surveillance across Ghana for informed decision-making towards malaria elimination. My name is Michelle Asigbase. Ghana has made significant gains in reducing malaria death through various interventions, including malaria vector control. And currently, as a nation, we are in the malaria elimination phase. However, this success is challenged by the increasing prevalence of resistance to insecticides that are used for malaria vector control. Also, malaria vector control in the country is going through a period of major change as new insecticides are being introduced for public health use through a new generation of mosquito nets and then through the indoor residual spraying products. So despite these existing control efforts, there remains limited comprehensive data for the spatial patterns of resistance and the species distribution in the country. It's therefore essential for us to have an enhanced surveillance system of these major vectors, of these major vector populations during this period that we are bringing in new insecticides. This would help us to understand where these new vector control products are more effective, and then it will also provide us with early warning signs if in case there are new insecticide resistance adaptations as we introduce the new insecticides in the country. So the aim for this study was to strengthen malaria vector control by mapping the distribution of Anopheles gambiae and then also to assess their insecticide susceptibility levels. The objectives were to develop a nationwide insecticide susceptibility map using the information that we obtained from the sentinel sites. The second was to establish the distribution of the Anopheles gambiae complex and then also to identify the resistance mechanisms that are involved in the resistance across the country. 28 sentinel sites were selected for this study, and the selection of the sites were based on information on agricultural practices such as rice and vegetable growing fields. The sites were also selected based on mining activities that were going on in the locations, and then other activities that could lead to the development of insecticide resistance. So for the purpose of this study, the country was divided into northern and southern sectors to match the rainy season pattern. Larval collections were done at the various sites using the required equipment or tools to collect the larvae. They were then transported to makeshift insectaries at the various locations, and then they were raised to adults under standard conditions for the test. GPS coordinates were taken also at the various sentinel sites. New insecticides that were tested included the chlorpheniramine, chlortianidin, broflanilide, and then we tested for some pyrethroids. We looked at bendiocarb also, permifos metal, and then we did some synergist assays using PBO. The new insecticides were tested using the CDC bottles. And then the susceptibility tests were done using the susceptibility test kits. So for the susceptibility assay, the insecticides were exposed to the insecticide susceptibility tube for an hour, and then afterwards were transferred back into the holding tubes, and then 24-hour mortalities were recorded afterwards. And for the synergist assays, the mosquitoes were pre-exposed to the PBO, and after an hour exposed to the insecticide that we were testing, and transferred to the holding tubes for 24-hour mortalities. And so 20 to 25 of the non-blood-fed females were used for this test, and the adults that were used were 3 to 5 day old. The experiment was done under standard conditions. They were fed with sugar solution after the test, after the exposure to the insecticide. We did also some molecular evaluation. So after the bioassays, 40 alive and dead mosquitoes were selected from the various bioassays that were done. They went through a series of DNA extractions. We identified the various species that were present. We did some molecular forms, and then PCR also to amplify the resistance genes, such as the KDR and the ACE1 mutations. Using the WHO criteria for determining susceptibility, populations that their mortalities after 24 hours that were less than 90% were considered to be resistant. So for this diagram, those that were below the red mark were considered to be resistant. The susceptible population were between 91 and 97. So populations that were alive that had mortalities greater than 98 were said to be susceptible. So from this graph, we have pyrethroids being resistant across all the sites. It is Permifos metal that we have susceptibility to the population. We also had some susceptibility to bendiocab at, I think, just one site. That's at Takwa. And that's for the southern sector assays. So for the northern sector assays, it wasn't that different from what we observed in the southern sector. Most of the population that was exposed to the pyrethroids were resistant. And we had susceptibility to Permifos metal in almost all the sites, except at Saboba. Okay, so the PCR that we did also revealed two species, Anopheles gambiae SS and Anopheles colusi in the population. And these species were existing in sympatry at most of the sites. Looking at the resistant mutations, the KDR West and then the acetylcholine esterase resistance mutations, most of the population were fixed. Most of the population was fixed for the KDR mutation, or almost fixed. We still have the ACE1 population still being a bit effective. We looked at the trends in the resistant markers over the years, looking at it from 2021 to 2023. And the top graph shows us the trend in the ACE1 mutation. In the ACE1 mutation. So in 2021, the frequencies were around, the average frequencies were around 0.6, and then it rose up a bit. And then in 2023, we can see that the graph has turned downwards. This is as a result of previous studies that was done, and the program was informed, and then so during that time, Permifos metal was not used much, so or it was even asked to be stopped. So we can see that ACE1, which is resistance to the resistance to acetylcholine esterase. Because of that, it has reduced. Looking also at the KDR mutation from 2021 to 2023, we can see that the trend hasn't really changed. It is fluctuating almost around the fixed population, explaining that our KDR in the bioassay data shows that the thing has already been fixed. So we didn't see any changes in the resistant markers. Looking also at the trends in the KDR resistant alleles, we looked at whether there were changes in the RR, the RS, and then the SS genotypes between 2021 and 2023. And for the RR, because the population is fixed, we didn't see any significant difference in the changes in the RR alleles, but there were a few changes in the RS and then SS. So for our discussion, two different Anopheles gambiae SL species were identified, and like I said, they were existing in sympatry in almost all the communities. And this was also confirmed by research that was done by Yosin et al. The high pyrethroid resistance confirmed in other places in Ghana was also done by others, and this is as a result of the use of pyrethroid in the production of the mosquito nets and then to do IRS spraying. PBO enhanced Anopheles gambiae susceptibility to the pyrethroids, and this tells us that oxidases are involved in the biochemical mechanisms. The products also with PBO would enhance susceptibility even in the presence of pyrethroid resistance. And this research that was done by Dazi et al. In 2017 confirms this current study, and through that study, the malaria control program, malaria elimination program, brought in PBO nets for us to use as a country. The study also detected multiple resistance mechanisms, such as the target site and the biochemical mechanisms to be playing in the population. The high KDR confirms phenotypic data that we have seen, and which shows that most of the population was fixed at most of the sites. And that's because of the high use of pyrethroids in the population. The low AC1 also confirmed the phenotypic data, where we saw that the ACE1 genes was slightly lower, and then making the carbamates and the organophosphates effective. So in conclusion, Anopheles gambiae were coexisting with Coluzi in the populations. The new insecticides that were tested, the chlorphenanil, roflanilide, and Primifos metal, are effective in almost all the sites. The high pyrethroid resistance across the sites that were surveyed, there was high pyrethroid resistance across the sites that were surveyed. And then we had multiple insecticide resistance mechanisms involved in resistance. These are my references. I would acknowledge the entomology team of the parasitology department of Noguchi, and then the National Malaria Elimination Program, and then the funders for this research, which are Global Fund and then USAID. Thank you for your attention.
Yes, any questions for Michelle?
So my name is Fred Binka. Thank you very much for this presentation. I stayed on to actually listen to this presentation for one reason. I think that was really very, very important what you've just done. But my suggestion to you is that next time when you're showing the distribution, show a map. Those bars will not attract any policymaker. You didn't even understand what you're saying about the Coluzis and the Anopheles gambiae. If you had just added a map, that will convey to many people exactly what you're talking about. But very excellent presentation. Thank you.
Thank you very much, Paul.
Okay, so I'll also say that that was a very brilliant presentation. I think in one of your slides, I don't know whether slide 15 or so, if you can. Yeah, this one. Okay, you talk about the frequencies, and I could see kind of proportions. I don't know what either you were trying to refer to proportions or frequencies, and if it's proportions, I could also see 1.2. So I don't know if you have any clarification for me in terms of that.
I don't really get this.
On your y-axis, you have frequency. So I don't know if you are trying to talk about proportions or frequencies as in the number of times.
So the figures there were the calculations for.
Okay, how did you arrive at the frequencies? Maybe that could help me to understand the trend over time. Yeah, I think we can go to the next one. I think this looks okay for me. When I look at the frequencies over here, I'll be able to tell that. But on that, the other graph, 15, yeah. I'm not getting the trend over, in terms of the y-axis. I don't know whether you are trying to measure the number of times over the course of the period, which is 2021, 2022 up to 2023, or its proportions. I don't know.
So the mutation frequencies were put into the formula for calculating the KDR frequencies.
Okay.
So it is from that formula that you can determine whether your population is fixed, whether it's at 1 or the level of fixation in the population. So it is
maybe somebody can help me.
Yes. The maximum should have been 1, but we just added the 1.2 so that it's a bit clearer.
Yes, this is a proportion.
Thank you, Michelle, for your presentation. Our next speaker will be presenting on evaluating vector and human interactions on malaria vector abundance and biting dynamics post-LLIN's interventions in Atantam, southern Ghana. Please, we would like to welcome Mr. Linus Doty.
Good afternoon, everyone. My name is Linus Doty, and I'm presenting on the topic evaluating vector and human. Okay, my name is Linus Doty, and I'm presenting on the topic evaluating vector and human interactions on malaria vector abundance and biting dynamics post LLIN intervention in Atatem, southern Ghana. And this will be the outline for my presentation. I'll take it through introduction and then some references. So WHO, according to their recent report, still outlines or states that Africa still bears the heaviest burden when it comes to the total cases of malaria recorded and deaths and total cases of deaths and cases recorded in sub-Saharan Africa. And these two complexes, Anopheles gambiae and Anopheles funestus complexes, they are responsible for the transmission of malaria in Africa. However, remarkable progress in malaria control over the last decade has been attributed to massive deployment of the long-lasting insecticidal nets and IRS. And these anti-vector interventions have led to a remarkable reduction in vector population and malaria transmission in multiple endemic regions. So Anopheles funestus and Anopheles gambiae have been reported to be the main vectors of malaria in Atatem. Preliminary data on deployment of LLINS in Atatem has shown a remarkable reduction of populations in Anopheles funestus and change in species composition to predominantly Anopheles gambiae population over a period. And selection pressure brought on by these LLINs may lead to behavioral modifications resulting in shift in feeding time, host preference, or increased exophily. So the main objective of this study is to characterize the species composition, abundance, and biting behavior of major malaria vectors in Atatem, and specifically to estimate the comparative abundance of outdoor malaria vectors. Also to investigate the dynamics of the outdoor-indoor biting pattern of the malaria vectors, and to investigate the coverage and use of LNIs and human behavior influence on malaria transmission in Atatem. So Atatem is a small farming community in the Adansi Asokwa district in the Ashanti region, where the community practice cocoa farming. And recently, the youth are involved in small-scale mining or galamsey. So this study this was a cross-section which we use the human landing catches. The study adopted the human landing catches, which was conducted for 12 nights, and this was done in the minor season, the dry season, and then in the rainy season. The minor season was done in November, the dry in February, and then the rainy season in May. So 2 individuals or collectors were stationed indoors and 2 outdoors to collect these vectors. And the collections was done from the hours of 6 p.m. to 6 a.m. in the morning, and these were put into 3 categories. The vectors collected, mosquitoes collected from the hours of 6 to 10 were grouped as early biting, and those collected from 10 to 4 as the late biting, and from 4 to 6 as the early biting mosquitoes. And a cross-sectional study design was employed to understand human activity and sleeping patterns in the community, as 30 households in the community were interviewed via questionnaire surveys and by observation. An ethical approval for this study was obtained from the Radiological and Medical Sciences Research Institute of the Ghana Atomic Energy. The data was summarized using the R version, a negative binomial mix model which accounts for overdispersion in count data was fitted to predict the abundance of the major malaria vectors identified, and the model included the seasons as random effects, and both the vector behavior data and the household survey data summarized using descriptive statistics. So from the study, about 7,304 mosquitoes were collected, and Anopheles gambiae and funestus were found to be the 2 main vectors biting, malaria vectors biting humans in the community. The abundance of Anopheles gambiae was statistically higher than that of funestus. But similar to Anopheles funestus, the outdoor abundance was higher than the indoor abundance. However, this was not statistically significant. So from previous studies in this site, it states previous studies states Anopheles gambiae and Funestus to be the two main vectors biting humans in this community, with Anopheles gambiae being dominant during the rainy season and Funestus in the dry season. But this study, Anopheles gambiae happens to be the main vector biting humans throughout the 3 seasons. And this might be due to the recent activity of Galamsey, which might have created breeding site for the Gambiae, might have created breeding site favorable for the breeding of Gambiae, as Funestus mostly prefers to breed in a more permanent habitat. So the hourly biting activities of these vectors, you could see biting activity occurring from the hours of 6 p.m. in the evening to 6 a.m. in the morning. However, Anopheles gambiae exhibited late night biting activity, which is the classical biting time for Anopheles gambiae. What this means is the adherence to the use of treated nets during this time might offer protection during this period. But outside this activity, a small peak during hours where individuals might not be protected was also recorded. That was around 4 a.m. when individuals might be out of bed. But when you look at the activity of Anopheles funestus, they were biting outside the time where individuals were protected, biting outside the intervention, which is a problem. What this means is this might actually undermine the efficacy of bed nets. So the dry season, during the dry season, the biting activity of Anopheles gambiae was still exhibiting the late night biting activity during the dry season, both the gambiae and the funestus. What was observed during the dry season was that individuals were spending more time during the sleep hours due to high temperatures indoors. So you notice people were spending more time outdoors, sleeping outdoors, and moving indoors when temperatures reduce in their room. So here you see late night biting activity during this period. But however, there was an early morning biting activity also recorded during this period where individuals were not protected. In the major rainy season, the late night biting activity of Anopheles gambiae was still exhibited, which is a classical biting time, which individuals will be protected when they adhere to the use of insecticide nets. Anopheles funestus still biting outside the times where individuals were not in bed, early evening and early morning, where they were not protected. So with the data on the ownership and use of the insecticide nets, so 93% ownership and usage was recorded in the community. And from the survey, it was noted that the permanent 3, which is a combination, a synergies-based net, which is also effective against the pyrethroid-resistant populations, is the most used net in the community. And from this also, as the high population of the community uses bed nets, studies shows that when a high population of individuals in a community adheres to the use of bed nets, it reduces vector populations and also transmission, and thereby also offers some protection against the few individuals who are not using the bed nets. And from observation in the community you also realized individuals were spending more time outdoors when they were not in bed and when they were out of bed. And also similar housing structure was seen in the community, mostly mud house with iron sheet roofing, which offer with open eaves, which is favorable or which allows these vectors to easy entry into these homes. In conclusion, this study indicates that there's a high rate of outdoor biting and feeding amongst malaria vectors in the study community. And it was also confirmed that there's a shift in biting time from the historical late night to early morning biting, indoor and outdoor of Anopheles funestus, and also recording early morning outdoor and indoor biting in Anopheles gambiae. And there's also high ownership and use of the long-lasting insecticides in the community, which prove the intensive work of the NMEP in attempt to reduce the malaria burden. And these findings have important implications for the epidemiology and strategies for the control of malaria in the study area. And it is recommended that attention should be given to interventions to switch target vector populations biting individuals during times that they are not protected, as this biting behavior presents in protection given by LLINs and IRS, especially in rural settings. And I acknowledge GAEC Binary for supporting this project through a sub-grant award from CRED and the faculty at APIS, University of Ghana, for their constructive comments and advice during this study. Thank you.
Thank you, Linus. Any questions for Linus? Yes.
Thank you, Linus, for the beautiful presentation. I could see from your BedNet survey that most of the inhabitants were using the permanent 3, which you mentioned was a synergist-based BedNet. From Gabriel's presentation, we realized that the synergist bioassay, where he used funestus, there was total restoration of susceptibility. And from Michelle's presentation, we saw that the gambies, even though mortalities increased, it wasn't fully restored. That means there's a possibility that most of them are still resistant, even when the synergist was introduced. So now that there's a shift from the funestus population to the Gambi population in this community, would you still advise that we continue the usage of the permanent 3, or we should look to other control mechanisms in that community?
So I will rather advise we go with the integrated vector management approach. As from studies, it proves the synergist-based nets prove to be effective against funestus population. So withdrawing that bed net from that site might force the funestus to increase the activity. So an integrated approach would be the best way to go. Thank you.
All right, thank you very much, Linus. So my question is about this slide. You mentioned it's titled ownership and usage, but what you can see is ownership. So your questionnaire, was it more tailored to ownership? Because you can own it, but you can't. What about using? I was thinking, looking at human behavior in terms of how it impact on transmission. You were going to do kind of like, while you're doing a collection, a bit like human behavior observations. While the collections were ongoing, you did HLCs, right? While the collections were ongoing, and I think this is a recommendation going forward, you incorporate like on-site not like questionnaire, but on-site usage of the net. So mosquitoes are collected per the hour for a span of 12 hours, right? So at every point in time within the hour, they indicate how many are outdoors, how many are indoors, how many of them, those outdoor, indoor, are under mosquito net. Because as far as I know, they may say that, yes, they own this type of net. But how about the usage? Because that is what impacts transmission. Do you get my point?
Okay, I get your point. Maybe I didn't come clear with the ownership and usage, but thank you. Yes.
Thank you. Thank you very much for a nice presentation. I have a question on the same side. I'm interested in the usage. In your submission, usage is high. As high as what? Okay? And within Ghana, we know that usage of LLIs falls below 40%. So if it is your study says that it's high, what was it? And what were the motivators for those using? Because this can help us in terms of implementation to share it with best practices for other people to adopt.
Okay, thank you. But I think I didn't come clear with the ownership. And so out of the survey, we interviewed 30 houses. And out of the 30 houses, 28, out of the 30 houses, they all own bed nets. And 28 out of the 30 used the bed nets. But it seems I didn't come clear with the diagram, so that's why it comes out like that. So that's why I said the usage is high. Ownership and usage is high in the community. Thank you.
All right, I hope your questions have been answered, but I think most of them were comments for the team to take up. So take note of those comments in future work. Thank you very much, Linus.
Okay, thank you.
You are discharged. Now we have the last person who stands between us and our lunch, and I hope that person will help us go for lunch on time. Derek Bansakite to present on genetic diversity and comparative insecticide resistance profile of Aedes aegypti across West Africa.
Hello, good afternoon. I'm Secretary Derek, and I'm here to talk about the little things I do with Aedes mosquitoes in. I said I'm Secretary Derek, and I'm here to talk about the little things I do with Aedes mosquitoes in West Africa. First of all, we know that Aedes-borne arboviruses are a major public health threat, and these viruses have caused large-scale pandemics globally, particularly in Africa, where these viruses are very, very much endemic. The problem with these viruses is that for most of these viruses, although some have vaccines, most of them, there aren't any drug interventions for them. And we also realize that urbanization and climate change contributes greatly to the shift in disease patterns for these viruses. And that's why most of the arboviral infection cases we report now are mostly reported in urban areas. Like I said, these viruses are very much endemic to Africa, and yet in Africa, there aren't, in most African states, there aren't any surveillance systems set up for the prediction and control of arboviral outbreaks. And because of that, we don't know the species of Aedes mosquitoes flying about in the various African countries and the viruses these mosquitoes carry. As such, the West African Aedes Surveillance Network, WASAN, has set out to contribute solutions to these problems by, one, investigating the genetic diversity of Aedes mosquitoes in West Africa by looking at mitochondrial markers, and also determining the presence of pyrethroid resistance genes or KDR alleles in these mosquitoes from its 19 member states. So to do this, in each member state, we set traps. We select 2 sites, and one of the sites has to be a site where in the last 10 years there has been an outbreak of an arbovirus infection. It could be any arbovirus, and also the other site has to be a site that has not had any reports of an outbreak of an arboviral infection. So, and these sites have to be at least 20 kilometers apart. And so for each site, we set 20 traps. We take the GPS locations of where the traps are set at. And then after some days, we set OV traps. We collect the trapped eggs and transport them to the Watson headquarters in Noguchi, Ghana. So when the eggs come to Ghana, Noguchi, we rear them into adults, perform the necessary morphological identification and molecular assays to determine the presence or absence of KDR mutation, also Sanger sequencing, and then we use RStudio for the necessary data analysis. So on to what we have got by far. So these are the countries where we have got, so out of the 90 member states, we have got mosquitoes from these 12 countries. And when we got the eggs, we calculate the egg density of these eggs we are receiving from the various countries, that's from the various towns from which from the various towns and countries from which the eggs were collected. And when we calculated the egg density, we realized that Niamey in Niger and Praia in Cabo Verde give us a high egg density. But this statistic depends on the period or the season in which the traps were set, and also the places where these traps were set. Which could be because maybe wherever they set the traps are washed with Aedes mosquitoes, that's where we are getting high egg densities. So after the eggs hatch into adults, what we do next is to, like I said, perform the various morphological identification to see whether they are Aedes mosquitoes or to see if they are Aedes mosquitoes, either if they are Aedes aegypti, formosus, or albopictus. And when we did that, we realized that most of the mosquitoes we are getting are Aedes formosus. But we also realized that from Togo and Nigeria, we got albopictus. And it's not shocking because in Nigeria, albopictus have been reported since 1991. So based on the adults we collected, as you can see from this table, in Ghana, Nigeria, and Togo, we worked on, from the various towns, we worked on at least 11 mosquitoes. But up above the table from Burkina Faso, Cabo Verde, and Cote d'Ivoire, we worked on very few mosquitoes. And that's because between the period in which the eggs were collected and were transported to us in Ghana, it was quite some time. And yes, I know we like to say that Aedes eggs are quite robust, but we realized that the length of the storage of Aedes mosquito eggs affects the viability of these eggs. And that's how come for these various countries, we have very, very small number of adults. So onto the various KDR profiling we did, we worked on the 1016, 1534, and for the 410, which we have problems with. We are supposed to do, but we have problems with that, so we are still working on that to troubleshoot and figure that out. And also for the mitochondrial markers, we worked on cytochrome oxidase 1 and neuraminidase 4 and 5. So onto the insecticide resistance, we use qPCR to detect the presence or the absence of these mutations or of these mutated genes. And what you are seeing here is a bar plot. It's a bar plot of the frequency of the various genotypes. That is for 1016. If you see VV, that is it doesn't have the mutation, or which means the mosquito is susceptible to pyrethroids. But if you see II, it means that the mosquito, which is homozygote resistant, it means that mosquito is very, very much resistant to pyrethroid. And if you see VI, it's just heterozygous. So for Cabo Verde, we see that most of the mosquitoes that we worked on are very much susceptible, but we'd have to take this result with a pinch of salt because once again, the mosquitoes we worked on in Cabo Verde are very, very much small. I think they were 6. But for Ghana and Nigeria, you can see that there's some varying amount of resistance and also susceptibility. For 1534, once again, it's a bar plot, and for the genotype frequencies on the y-axis and the various towns from which the mosquitoes were collected are on the x-axis. Once again, if you see FF, it means that the mosquitoes are very much susceptible or they do not have the mutated gene. If you see CC, meaning they have the mutated gene. And once again, looking at Cabo Verde, Gambia, if you look at Cabo Verde, you see that most of the mosquitoes have the mutated gene. For Gambia, they do not have the mutated gene. But once again, remember, the samples on which we worked on from these countries are very, very small. But for all other countries, we are seeing a varied frequency of these mutated genes. So what we did next was to find the proportion of allele frequency. So in Ghana and Nigeria, so for this one, we did it on mainly Ghana, Nigeria, and Togo. These are the countries where we got very high amounts of mosquitoes. So that's why we are working on this. So for Ghana, Nigeria, we can see that most of the mosquitoes here, depending on the gene, the mutated gene, either 1016 or 1534, most of the mosquitoes here have a high amount of the susceptible gene. That is the allele for the susceptibility is very, very high. But for Togo, across both 1016 and 1534, realize that there's very, very much high amount of what's it called, the mutated gene. That is the alleles that represents a mutation. We are seeing very, very much high amount. And if you remember from what I said earlier, we set traps in 2 sites. That is where one site has to have recorded an outbreak of an arboviral infection in the last 10 years. And we check to see if the allele frequency corresponds with that, corresponds with that. And for the 1016, we didn't see anything, but for 1534, we see that, yes, we see high amounts of the allele of the mutation in the site that has experienced an outbreak. So what we did next is to calculate the genetic distances according to the KDR profiles. So what you are seeing here is a PCA plot, and the PCA plot is used to tell how similar or dissimilar samples are by clustering. So from this plot, you can see that Brikama town and Kanefin, which are both towns in Gambia, are very, very, very much close, meaning that according to the KDR profiles that we worked on, these samples have similar KDR profiles. And Anyama and Valon, even though both are towns in Cote d'Ivoire and very, very much close, you can see that they are very, very much far apart. Jagbele and Hanukope are towns in Togo, and they have similar KDR profiles, which is not shocking because Togo is a very tiny sliver of land. Same for Gambia. So but then for this plot, this is a qualitative plot. So to know how far apart these towns are, according to the KDR profiles, we developed an FST plot, and based on this FST plot, you can see that Jagbele and Hanukope are very, very much close to Ouagadougou. Also, for this plot, the bluer they are, the more closer they are, and then the redder they are, the farther apart they are. So if you look at Brikama town and Valon, you can see that these towns are very, very much far apart, because meaning that they do not have similar, like they are very, very much dissimilar according to the KDR profiles. After we calculated the various genetic distance, and this is what we got. So onto the mitochondrial markers. If you remember, we also did some sequencing to determine how different or how diverse the mosquitoes from the various West African towns, which we have got mosquitoes from, are very, very much similar or different. So based on the sequences, we concatenated the sequences. That is, after the various sequence analysis, and based on these 3 genes, that is the cytochrome oxidase 1, neuraminidase 4, and 5, we concatenated these genes. That is, we put them next to each other. We joined them to form one long sequence, to form one huge long sequence. And based on that, we developed this plot. It's an admixture plot. So in this admixture plot, what you are supposed to see per sample, per country, is that, say, prior 04A, which is a sample from Cabo Verde, what you're supposed to see is that each sample from each different country is supposed to be very, very much different. That is, if the sample is from Cabo Verde, it's supposed to be a lot more. The genes, according to these genes, they are very much supposed to be very similar to you are supposed to see a higher amount of orange, same for a higher amount of black, same for Nigeria, supposed to see and then for Togo, blue. But what you are seeing on this plot is that we are seeing that the mosquitoes from the various countries, they are not very, very much distinct from each other according to these genes. That is, they are very much similar. You are seeing like mixtures of these genes from mosquitoes in these various countries, and what that means is that genetic gene flow, and it could be because of various reasons like transport, and also maybe the mosquitoes are flying from these various countries to different countries to mate. It could be that. So based on that, we developed this phylogenetic tree. And once again, based on the results we are seeing from this phylogenetic tree, we are seeing that this phylogenetic tree reiterates what we see in mixture, because this tree beyond any distinct clusters. Maybe you can say that you are seeing a cluster with the samples from Cabo Verde, that is prior. But if you look back at the admixture plot, you can see that most of the samples from Cabo Verde, they have like similar proportions of genes from these various countries, and that's how come they form a cluster. And based on that, we are seeing that we aren't seeing any distinct clusters based on samples from different countries, and yes, it supports our admixture results. So what is the point of all of this? What is your takeaway from all of this? What we are seeing is that there's varied genotype frequencies between West African countries based on the 1016 and the 1534 genes, and we are seeing that the 1534 mutation appears to be associated with the occurrence of disease outbreaks, and also we are seeing similar KDR profiles between various towns in the various West African states from which we got our mosquitoes or our eggs from. We're also seeing that Aedes populations in West Africa are very, very much genetically diverse, and yet they are very, very much interconnected. And this finding suggests that there's a potential for spread of vector traits such as insecticide resistance and virus transmission. And also, what this means is that there's a need for a regional collaboration in vector control strategies to prevent and predict the control of arboviral outbreaks. Thank you. These are the people I'd like to acknowledge. That is Professor Samok Dazi, Dr. Joanna Okoli, obviously myself, and the parasitology vector group, and also the countries, the various WASAM members that have submitted samples so far, and these Mozibiome, TBC, and WASAN. Thank you.
Thank you very much, Derek, for a brilliant presentation. Any comments or questions for Derek? I see a hand at the back, very back.
All right, thank you very much, Sakite. So, a quick one about the gene flow, especially on your phylogenetic tree. So, I don't know if it's because of where I'm seated, but I can't really see the bootstrap values. So, I've seen the clusters, but the bootstrap values are not really visible. Yeah.
Sorry, so about that, should I mention them for you? So, from here, you can see 0.5.
No. So I wanted to understand. Of course, you need to understand the lineage, right, and compare to strains in the gene database. So, per what? Okay, I can't really see from here, but
you can come in front.
I can come in front. Okay, what I'm just trying to say is that how close are they related? To not just amongst themselves. Yes, you did that in the gene flow, but to other genes, like in Africa and in the world.
Okay, so about that, after lunch we'll talk about it. Okay, thank you.
No, you can talk about it now. Okay, after lunch.
After lunch.
All right, thank you.
Thank you, Derek, and thank you for this wonderful work. As you said, it's a collaboration between different countries. And this data is very important, especially since we're having a lot of outbreaks of dengue in many countries. Now, but your data on the different countries, especially with the clustering, Cape Verde is an island. That's the only island you find. So, why do you have any reason why probably you're having the distinct, especially for Cape Verde, those distinct clustering? If you look at the phylogenetic tree, it looks like Cape Verde seems to have quite a distinct. Could it be the reason that it's an island, or you have some other reasons?
I think it could be because it's an island, but lunchtime I'll tell you more about it. See, to be fair, I don't want you guys to get very hungry. So when we are eating, you ask questions. I'll tell you more.
Hello, Derek. That was a very nice presentation.
Thank you.
But I'm a bit, confused, or not confused per se, but to say that I see the results, the study, the results a bit biased because you are looking at numbers collected from various countries, and you have very low numbers in some places and very high numbers. Won't that bias the study?
Okay, so about that, so for the countries where we got very low numbers of mosquitoes, we asked them to send eggs again. So, like I said, it's an ongoing study, so they send the eggs again, and we have hatched most of them, and then we'll do the same thing, and then when we are done, we'll share the results. Thank you.
Thank you, Mr. Sakite, for your presentation. So on behalf of my chairperson and I'd like to say thank you to all our speakers for their insightful presentations, and also to you, our audience, for your engagement. Now we'll move on to lunch. I think we are all hungry here.
Over to the MC.
Just one more announcement. The T-shirts are ready for collection, but because we don't have a lot of time, please go for lunch. And if you have to leave earlier than the end of the second session, then you can pick up your shirt on your way out. For everyone else, it will be available to pick up after the second session. Thank you. Mr. Godwin Amlalo, the lab manager for Vestergaard Noguchi Vector Labs. Thank you, chairpersons of this session. You may go ahead.
Good afternoon and welcome. We hope we are all fired up for this session. For the plenary, we have Dr. Jiwona Ifia Brago Akoli, who is a senior research fellow from Noguchi, and she'll be talking on the topic unraveling the potential of using mosquito-made gut symbionts to control mosquito-borne diseases.
Hello. Yeah, great. Good afternoon, everyone. And I deem it a great honor to be here to share with you, not all, but some, given the time I've been given, of the results or the work that have been ongoing in my lab. I'm here to talk to you about symbionts. So at some point, you would actually think I'm a microbiologist, but I'm really not. I'm an entomologist, just trying to find a means to the end that we're all looking for in symbionts. Okay, it doesn't want to move. But can't the pointer work? Okay, great. So this is a map of what vector-borne disease distribution was as of 2019. We can appreciate as Ghanaians the burden of malaria, which is in red. However, in other parts of the world, we see predominantly diseases that are transmitted by Aedes mosquitoes, which are the chikungunya, the dengue, and the yellow fever Zika. This map, I believe, should have changed by now, because even though we still have malaria, we still have a huge case of dengue and chikungunya encroaching into the African, especially the West African sub-region. So I won't talk too much about this. All this while, we have been trying to break the transmission cycle of mosquito-borne diseases with chemicals. And from this morning's session, we've heard quite a lot about insecticide resistance, and I think we already know these. So I won't go too much into it. However, we know about insecticide resistance and how much it's really spreading at this point. You can see Africa is heavily burdened by this case of insecticide resistance. However, blocking transmission shouldn't just be about using chemicals, and we know how the mosquito is already fighting back. So we can appreciate this as elementary biology with the transmission of mosquito-borne diseases. All this while, we have been targeting these using our therapeutics, and now vaccines are also being designed to target the human specifically. And then all that has been done for the vector is to bombard it with chemicals. However, how about we also look within the mosquito itself? Let's try to find something that we can use to target the vector so that instead of killing it, we are actually, well, probably just letting it stay so that it won't fight back, but we are actually targeting what is within it. So basically, we are trying to find a mosquito vaccine. A vaccine, something that, when the mosquito takes in and takes in a pathogen thereafter, the pathogen would not survive for it to be transmitted by the vector. So within the midgut, there are several stop points. We already know the mosquito stages of the Plasmodium parasites, so I won't bore you too much with that. But there are significant points with which we can target. One of such is the point when the parasite traverses the midguts to become ookinids, or we can even get to the point where we actually target the oocysts or prevent them from developing further, or even the salivary gland stage where we have the sporozoids that are ready to be transmitted from the mosquito to the human. So this is the midgut, a lot of things happening there, and it's a significant bottleneck for parasites in the mosquito vector. So what are the functions of some of these mosquito microbiota? They are well studied over decades, but we haven't actually used them as it stands. I think the best bacteria that has been used so far is Wolbachia, and that has been Aedes, predominantly Aedes. And Anopheles is quite missing when it comes to finding the symbionts that actually does the job. So here we have some of the few functions. There are many, but I'll just talk about the ones that seem relevant to our case. One of them is that they actually support larval development and survival. If a mosquito, just like all of us, we are all human beings, and we need some form of microbes to help our hemostasis and the way our bodies function. It's the same with mosquitoes as well. So you see here, this is not our plot. This is from a publication. That is not ours. But you see here that mosquitoes that have been devoid of their midgut microbiota don't survive much. But then those that have the bacteria returned to it, or that are the wild type, or those that weren't given antibiotics, in this case, the axenic were mosquitoes that were treated with antibiotics, then we see that the ones that don't have bacteria don't survive well. This is a plot that my lab shares a lot. Yes, I can see her reacting to that, but you know why. We know that bacteria would proliferate a lot after the mosquito has taken a blood meal. So in that blood meal, the mosquito would need the bacteria some way, somehow to help it digest the blood. So after a blood meal, you see the bacteria spike up. So the blue is the control, a normal mosquito which hasn't been treated with antibiotics. However, if you've been treated with antibiotics, your bacteria load seems lower thereafter, even after you've blood fed. What is important to our case in terms of using it to target parasites or using it as a vector control measure is the fact that it negatively impacts Plasmodium. Here again is a very insignificant paper we usually reference in my lab. We're looking at mosquitoes that were given PBS, mosquito that was given the end. I won't talk about these in between, but I'm more interested in the control. And then this is a bacteria called Enterobacter. It's an Enterobacter cloaky species that was isolated from a Zambian arabiensis. So that's why the Z is there. You see that those that have these bacteria would significantly have low intensity of oocysts in the midgut. If you go to ookinids, we see the same, very sick, especially with the Enterobacter cloaky, and the same with sporozoids. They are very much reduced. So bacteria is important. They can do something for us. But how do we find them? How do we even know how they are doing these things? Because we can't just pick any bacteria and just pour it into the environment. Remember, we have environmental issues. Some of these bacteria may also significantly affect humans and vertebrates. So we have to be careful, carefully study them and understand what they are doing, how they do it, and how we can even use it as a control measure. So in my lab, we have concentrated mostly on these two, Enterobacter and Serratia, for various reasons. One, there are two bacteria that proliferate after a blood meal. So we think their interaction with the Plasmodium may be very significant to our case. So we ask these questions: what are the bacteria candidates that are important? What are the ones that we should be isolating and studying? Okay, we want to understand their dynamic networks, and probably expand beyond Enterobacter and Serratia, because there could be others. We just probably haven't studied them yet. We also think that instead of using the cells, picking the bacteria and engineering the bacteria and putting it back into the vector, we think maybe their biomolecules may be more friendly to use, and probably will be more acceptable by the community to say, I'm bringing a product, rather than pump the community with bacteria. So we are also looking at their biomolecules and how efficacious they are against Plasmodium parasites. Then we also want to understand how. So what are the gene targets? Are there targets, when I put this bacteria and the Plasmodium together, what are the gene-to-gene interactions? And we want to understand that better, because that could be the way forward. So we are studying mosquito host immunity. We are also looking at the parasite itself, the transcriptomics, and how they react when they come into contact with the bacteria. So a few results. I'll mention the person who actually has predominantly done the work. So this is a student called Lillian Chiamaka. She's Nigerian. She came to Ghana to do the master's at APIS. And she studied these two bacteria. What she did was we wanted to know whether these two bacteria are important against survival. So if we give the mosquito more of these two bacteria, are we increasing or improving its survival? We don't want that. We really don't want them to survive too well, right? However, if we take them away, how do they also fare? So what she did was she picked mosquitoes. She gave them antibiotics to get rid of. Again, antibiotics may not completely take away the bacteria in the mosquito. However, that was her study design. She gave antibiotics to a set of mosquitoes. So those are the ones you see in green. And then for mosquitoes, for the other set of mosquitoes, she would give more Serratia or more Enterobacter. And then the control was a wild type. She didn't do anything to those ones. So what we see here is that we have a significant decrease in survival if the mosquito is aseptic, just like we saw in the previous literature that I shared. However, with Serratia and Enterobacter, they go very well. There's no significant difference between those and the wild type. So it means that these two bacteria are necessary for survival. They add on, like they support the mosquito in survival. Taking them away means that you're going to end up killing them so much. Then she also looked at fecundity. At the end, if we add more Serratia, more Enterobacter, we don't want to be enhancing fecundity to too much of a level. So she also did this work. So from the mosquitoes that survived from here, she pushed them onto here to look at and gave them blood meal and saw how well they laid eggs and how well they hatched. Again, we see there's no significant difference between any of the groups here. So these two don't affect fecundity. Means that if we were to use Enterobacter or Serratia, we will be having near normal wild type mosquitoes. They will be fine. Plus, we won't have any significant increase in fecundity. Then we have Esinam, a colleague who joined my lab about 3 years ago. She's now a PhD student in the US. She got a Global Challenge Research Fund and did this work I'm going to show you in the University of Glasgow. So like I said, we want to explore the metabolites. We are not too happy. We may hit a fight if we come using cells. So we wanted to explore the metabolites just so that we use products instead. So what we did was we dissected midguts from the mosquito Anopheles gambiae, collected here in Ghana. We would plate them and get the cultures out. We would identify these and be sure that they are Serratia or Enterobacter. And then we put these in liquid culture for a certain number of hours. So we had what we call in time point. 30 minutes, 1 hour, 2 hours, 4 hours, 6 hours, and 12 hours. And then at these time points, we would take the culture out and then spin it down and then take the supernatants. We don't want the cells. So what do? We filter them. We filter the supernatant just to be sure they're devoid of cells. And then that filtered supernatant will lyophilize into a powder. So now you think of this as a drug. Okay, so something we can just do an assay with. So these lyophilized supernatants are added to gametocyte cultures and fed to the mosquitoes and dissected, I think 14 days later to look at the oocyst stage. What she found was this. In the mosquitoes that received Enterobacter and Serratia lyophilized product, we see that Serratia, the mosquitoes that have Serratia specifically had less prevalence of the parasite. So entero and control didn't have any significance. They weren't different. But the ones that have Serratia, you see that if you receive Serratia, you are less likely to be to have the parasite. And then here too, at the end, we wanted to look at the oocyst numbers. Again, Serratia topped. We see Serratia has significantly lower oocyst number. So we're asking, why is entero, well, literature says entero does the work, but with Serratia, we asked that, why? Why is that? And that is because Enterobacter seems to act quite differently from Serratia. Enterobacter seems a bit more versatile, volatile. They produce what we call reactive oxygen species, which I believe is very short-lived. So the time point with which Esinam did her work was 4 hours. We use a 4 hours product. It may appear that Enterobacter, the reaction of Enterobacter towards parasites may happen earlier than 4 hours. So currently, our lab is looking at earlier time points to see whether Enterobacter would have the similar reaction to reducing oocyst numbers as Serratia did, but an earlier time point than 4 hours. So we've moved towards 30 minutes and fine detail between 30 minutes and 4 hours to see what that would show us. Somebody will ask, so why are we taking this? If we have a product, what could we possibly use it for? Now, this is an ATSB. I'm sure it's one of the new technologies that are up and coming, and it's being looked at for deployment. However, we feel that having a product like this, we could target the parasite, could potentially improve on ATSBs. If you don't know what ATSBs are, I hope you all do, it's just a toxic sugar base. So it's sugar to attract mosquitoes, but it has a toxin in there where the mosquito would pick and die thereafter. But we know our story. We know things about chemicals and trying to kill the mosquitoes. They usually fight back. So what if we have mosquitoes, gravid mosquitoes or newly emerged, or even blood-fed, who are now going to look for sugar meal to replenish themselves before they lay eggs? The ATSBs, yes, will be dead. If you take it, you die by toxins. But what if the toxins don't kill them? It means the ATSBs are not going beyond killing the mosquitoes. So that is where metabolites will come in. The metabolites inside them would then prevent the development of the parasite. So the mosquito may not have died, but we have an added ingredient in the ATSB that would target the pathogen. There's a paper that I saw that I found quite interesting. So this paper used an anti-malarial drug, atovaquone, and exposed mosquitoes to atovaquone. And here we are seeing they either did it 24 hours before the mosquitoes were infected with infected blood meal, or 12 hours post-infection. What they see, the circles here, is the control. So a mosquito that did not receive the atovaquone against mosquitoes that received it. You see that there is no oocyst in those mosquitoes. If you give the atovaquone to them before infection or after infection, they act the same. So our question is, could we also use this product? I don't know. I wouldn't say use it in sprays, but you could probably coat our nets or, I don't know, a surface or our walls, something with these metabolites. That eventually mosquitoes land on them after blast feeding, because they would rest on walls, will be exposed to these chemicals, and thereafter the pathogen would die within them. Serratia also produces podoglycin, which is a very red pigment. I think it's not just Serratia that produces it. However, this podoglycin is known to be a larvicide agent. So exposing the metabolites of Serratia to these larvae, to these podoglycin, would effectively kill the as larvicides to control larvicides in their breeding habitat. So this is a mosquito that has received the podoglycin against the normal larvae, and this one didn't survive. So in summary, I am saying that two bacteria that we've been studying in the laboratory have shown importance for survival in mosquitoes. They are important for the mosquito survival. However, they do not affect fecundity. We then ask ourselves, if this is all right, then how much of these are we going to increase in the mosquito buy? How much is too much? How much is too small? How much of these products or how much of these cells are we then going to expose the mosquito to? And that is one question we are trying to answer in our laboratory right now. We know that the products of these microbes have antiparasitic activities. However, we asked this question, which stage of the parasite is most affected? Is it the gametocyte stage? Is it the oocyst stage? Is it the eukinase stage? Can it affect sporozoites? Those are some of the questions we're asking. So we are doing these studies also in our lab to find out. And then we also know that bacterial effect may be dose dependent. Looking from our work from the Enterobacter, Serratia did it at 4 hours metabolite, but Enterobacter didn't do the same. So again, we ask ourselves, is it best to use the cells or is it best to use the product? And again, those are questions we are answering in our lab. I will end here by showing these, and these are all the areas we are really trying to explore. We want to understand fecundity much better when we have increased these metabolites or increased these cell products in the mosquito immune system, how the mosquito is responding to it, because we don't really want to create a new mosquito by putting in more bacteria than it actually needs, right? So we need to understand how the mosquito responds to the metabolites. We're also looking at the plasmodium itself. We need to understand how the mosquito bacteria is interacting with the parasite itself. Does the physiology of the parasite change when it comes into contact with this bacterial product? And yes, there are other pathogens that are transmitted by mosquitoes. We need to study also whether, because if you look at ATSB, it's not only Anopheles that's going to be taking the ATSB, right? Aedes would, Culex would. How do they affect those and the parasites they carry? We also need to understand how this works in an ecological system. We can't think mosquitoes are working in silos. So if we're supposed to expose this metabolite into the environment, how is the ecological system changing? How are other arthropods being affected? It's also one important question we need to ask. Seasonal variation is very important. If we're supposed to put if we put the metabolite here right now, during the rainy season, will it wash off? How does it play out when it rains or it's dry? And then we also need to think about the other animals. The same water, if you put protoglycin in, the cow would come and drink, for example. How is the exposure of that going to affect others? So yeah, I brought 2 of our favorite mosquitoes. So this is Culex, I think, and this is Aedes. Again, can we use bacterial-mediated control to control of these? I would end here by thanking my lab. I call it the Mozibiome Lab. You see us on Twitter, it's us. And yes, many people have passed through the lab, and I'm really grateful for how they've contributed to, initially was my vision, but I think I've made them all buy into it now. So they are all with me, and I thank all these for supporting me in various ways. Thank you for your attention.
Thank you very much for the insightful presentation, Dr. Joelna. It's now time for questions. Any questions? Yeah.
Thank you so much, Doc, for this. Your research is really interesting. My question is, with the isolations you do with the microbes from the midgut, do you check whether they are resistant or not? And I think there are studies that have looked at mobile genes. So when we feed these mosquitoes with these microbes, is there a possibility they might pick some resistant genes from the mosquito? Because I'm sure if they do not die, they could still bite. Is there a possibility they could transmit some of these to humans when they pick resistant molecules from the mosquito, or vice versa?
Thank you. So we don't check for, you're asking about AMR, like antimicrobial resistance. We don't check that. And that is because these mosquitoes, well, the bacteria are isolated directly from the mosquitoes. We don't get them from outside of it. So unless you are saying that as we keep using them in the laboratory, which is bacteria, that's what they do, isn't it? They would change forms depending on the pressure or the stresses we are giving it. That is valid. But we haven't looked at the antimicrobial resistance of these bacteria that we have. As to whether they can transfer the bacteria from themselves to the mosquito, I doubt, to the human through bites. I don't think that happens. I think I've seen just one paper that have looked at. I think the bacteria, the mosquito rather can pick from the skin of the human, because yes, we also have bacteria on our body, the surface of our body, isn't it? So the mosquito, while biting, could pick those bacteria, but the bacteria from the mosquito cannot be transferred to the human.
Yeah, mosquitoes can sometimes transmit some bacteria to us. Actually, my last day in the insectry as a PhD student, I got bitten, and I had necrotizing cellulitis of my hand. And so I had to be given some antibiotics to get rid of that. So I have a personal experience.
What mosquito was that? Anopheles?
Anopheles gambi. Yeah.
Okay. So I'm wrong then.
Yes, thank you very much for the wonderful presentation. I have a question about the bacteria, the Serratia. Like, can the mosquito, will it be able to transfer it to its offsprings when laying the eggs?
Very, very good question. I think that's one direction we want to also look at, because these bacteria we isolated from the midgut. However, Serratia massicens is one of the mosquitoes that have, one of the bacteria that have quite a ubiquitous representation in the whole mosquito system. So you can find it in the mammalian tubules, you can find it in the reproductive. I think I've read about that. We haven't done it ourselves. But again, I think my lab group would agree that we have been talking about looking for it in the reproductive system to see whether we can find it in the mosquitoes that are, at least we collected from Ghana, to see whether it's there. So it would be brilliant if that is the case, because then it means it can be made sustainable by itself, because then the mosquito would pass it on to its progeny. We are all waiting to see what we find, but yeah, that would be a brilliant way to go. Yeah.
Okay. Thank you very much, Dr. Joanna. Good work. Yeah, so mine is on, so one critical element of any insect or any organism to be able to transmit, especially the vectors, is the ability to survive. So, and I see that you were trying to associate some bacteria to, especially looking at the trophic cycles, the blood feeding stages. So the idea is that the longer the mosquito lives, the more dangerous it is, because then it allows the parasite to develop inside their body. So do you find, or have you, through your work, found any kind of bacteria that's associated with, and I think you mentioned about, I didn't hear it, with survival, like allowing mosquitoes to survive? And also, do you see a kind of trade-off? Because normally, for any trait that is beneficial, the mosquito will still maintain it, but then to trade off some other thing, either to have low egg fecundity rate to be low, or the developmental time will be low. So I'm just trying to find out if you have been able to find any kind of correlation or any association between a specific bacteria that allow the parasite or allow the mosquito to survive, and whether there's any trade-off in any of the other traits. I don't know whether I'm making sense.
Yeah. I think the simple answer is no. We haven't found, or we haven't even looked for that bacterium that can do that, one that will make it survive longer. However, these bacteria, again, are symbionts. They naturally occur in the mosquito. So, of course, that probably means that they need it. For one way or the other, the mosquito naturally needs it for its physiological functions. I believe when it comes to trade-offs usually happens when the other party is quite pathogenic. And so we'll try to give something off to keep it, even if it has a little benefit. However, these bacteria are not pathogenic to it at all. Like I said, Serratia and Enterobacter actually aid in blood digestion. And the others may help in some form of nutrition or sometimes even mating. There are some bacteria, I think that's in Drosophila. There are some bacteria that if you take out, the mating system becomes a bit funny. So with these bacteria themselves, I don't believe there's a trade. Again, I haven't studied it, but I don't believe there would be a significant trade-off because they're already symbionts and they live together happily.
Dr. Akoli, thank you very much. Let's all give a hand of applause. Okay. So our next presenter is Dorothy Obobi, and she'll be presenting on efficacy of ivermectin on multiple insecticide resistant Anopheles gambiae sensulacto, Aedes aegypti, and Culex mosquitoes from Ghana.
Organochlorines, carbamates, and organophosphates. And these two interventions have substantially reduced malaria burden in Africa. However, the efficacy of these tools is under threat due to the spread of insecticide resistance among mosquito vectors and report of reduced efficacy of ITNs and IRS in phase 1 and phase 2 studies.
There is therefore the need to develop new interventions to combat insecticide-resistant mosquito populations. And one drug that is currently under evaluation to assess the efficacy against mosquito population is ivermectin. So ivermectin is an antifilarial drug that is used to treat worm infestation in animals and then humans. And it has a low risk profile for humans, but it is toxic to mosquitoes. And this is because the target site of the ivermectin in mosquitoes, which is the glutamate-gated chloride channel, is lacking in animals and in humans. That is why it is toxic to mosquitoes, but not toxic to humans. Ivermectin can be administered to mosquitoes through mass drug administration, where the mosquitoes feed on those who have taken the drug, and also through attractive toxic sugar bait. Apart from this, it also has a different mode of action compared to these insecticides that I mentioned earlier on. And several studies have demonstrated ivermectin's ability to control mosquito population, even viruses and then parasites. However, there isn't much information on the effect of ivermectin on multiple insecticide-resistant mosquito population. So the aim of our study was to investigate the impact of ivermectin on multiple insecticide-resistant Anopheles gambiae sensulato, Aedes species, and Culex species from Ghana. And the main objectives were to assess the effect of ivermectin on wild-caught Anopheles gambiae SL, Aedes, and Culex species. And the second was to determine the phenotypic resistance of these mosquito species, and also to determine the genotypic and metabolic resistance of these mosquito species. So for our study design, it was a cross-sectional study, and it was conducted between May 2023 and June 2024. And we collected the Aedes species and the Culex from Kolebu in the Greater Accra region, and the Anopheles from Cape Coast in the Central region. And we collected them from these areas based on previous studies that showed that they had resistant mosquitoes. So the larvae were transported to the University of Cape Coast and raised to the adult stage. And we performed the ivermectin susceptibility bioassays on them, and also the WHO susceptibility bioassays on them. So with the ivermectin bioassays, what we did was to perform serial dilutions of the ivermectin in 10% sugar solution. And we obtained a number of concentrations for each of the species tested. So for Anopheles, we had 6 concentrations that we tested. For the Aedes 7, and for Culex 5. So after that, what we did was to aspirate the adult mosquito, that's 3 to 5 days old, into paper cups. So we had 20 mosquitoes in each cup. And then we added a dye to the concentrations to act as a marker to identify the mosquitoes that fed on the ivermectin. So we did that, and for each concentration, we had 12 replicates for it. So we did that. We stuffed the mosquitoes for 12 hours and then fed them for 12 hours, after which the fed ones were transferred to new cups, and they were provided with 10% sugar solution. Afterwards, they were observed for mortality every 12 hours up to the 48th hour. And the test mosquitoes were kept for molecular analysis. So for our molecular analysis, we took, if it was available, 10 alive ones and 10 dead ones from each of the concentrations. So we also performed the susceptibility test, and we used 5 insecticides from the classes I mentioned earlier. For the pyrethroids, we used 2 insecticides, and then for the other classes, we used 1 insecticide each from it. And then we followed the WHO standard protocol to perform the test. So we went on to identify the species of Anopheles gambiae SL and then Aedes species. And then we went on to detect the KDR mutations in the Anopheles and the Aedes species. And also for the Anopheles, we detected the AZ1 mutation. I must mention here that we didn't do that for the QLS because we didn't have controls for the QLS. And we went on to also perform biochemical assays on also a subsample of the population just to determine or know the metabolic resistance of the population we're working with. So these are the results for the susceptibility test. The Anopheles gambiae susceptibles, that's Kisumu, were susceptible to all the insecticides tested. Then for all the three populations, they were resistant to deltamethrin, permethrin, and then DDT. But for the QLS species, they were susceptible to bendiocarb, and both QLS and Anopheles. Okay. Yes, so for deltamethrin, all the populations were resistant to. For permethrin 2, they were resistant to. For DDT, they were also resistant to. But for bendiocarb, the QLS population was susceptible to bendiocarb. And when we tested against malathion to Anopheles gambiae SL, and then the QLS population were all susceptible to. And then we went on, because our focus was on the ivermectin, for this presentation, I just showed the KDR frequency we obtained for the ivermectin samples analyzed. So for the KDR West for Anopheles gambiae, we had a frequency around 74%, and then for the AC1 was 24%. Then for the Aedes, for the other mutations, the V410L and the V1016I, we had a bit lower mutation frequency compared with the F1534C mutation, which was a bit high, around 72%. And then we went on to with our biochemical assay. So we tested, we estimated the activity of 5 different enzymes. So alpha esterase, beta esterase, misfunction oxidases, cytochrome P450s, then glutathione S transferase, and then acetylcholinesterase. So for the Anopheles gambiae population, we compared it with the susceptible, that's a Kisumu. So the blue one that we are seeing here, is the susceptible population, and the red is the filled population. So for all 5 tested enzymes, they showed significant difference. There were significant differences between all 5 enzymes tested, between the filled samples population and then the susceptible population, indicating the presence of metabolic resistance in that population. And for Aedes population, we observed a similar trend, except for the GST, that we didn't see any significant difference between the control, the Aedes aegypti susceptible strain, and then the filled population. So these are the results of the ivermectin susceptibility bioassays in terms of mortality. So for all the species, the mortality increased with increasing concentration, ivermectin concentration, and also post-exposure observation time. So this box plot is showing the results for the Anopheles field population and the susceptible strain. So at 12 hours, we observe lower mortality, which was variable area, we saw variability between the mortality of the different concentration. But as at 24 hours, we realized the Anopheles gambiae susceptible strain, we recorded nearly 100% mortality for all concentrations tested at the 24 hours. But for the wild population, we realized we observed a delayed mortality, which required more concentration and then time to obtain 100% mortality. But for the concentration, the highest concentration we tested, 0.0125%, at 36 hours and 46 hours, we obtained 100% mortality. Now, for the Aedes species, for the lower concentrations, starting from down here, we recorded almost 0% mortality, especially at the earlier times. But for the higher concentrations, we observed mortality range between 75 to 98%. But interestingly, none of the concentrations tested could achieve 100%, even at the latter times, indicating a bit of resistance of the population towards the ivermectin concentrations tested. For the Culex species at lower concentrations, we recorded low mortality. And then at the higher concentration, we recorded a higher mortality. And then at the 36 and 48 hours, we recorded almost 100% mortality for the higher concentrations. So we went on to also determine the LC50s and then the LC90s for all the three species. So we realized that for each species, as the concentration increased, we needed very short observation time to obtain the LC50 and then the LC90, as in obtain 50% of them dying and then 90% of them dying. And vice versa, when the concentration was low, we needed much more observation time to achieve the mortality we're looking for. And then across the species, the three species, we realized Anopheles gambiae was more susceptible to the ivermectin, followed by the Culex species, and then the Aedes aegypti. Yeah, so to conclude, the population that we worked with, the mosquito population, were highly resistant to particularly pyrethroids and the organochlorines, and these have been confirmed by other studies and even the IR mapper that Dr. Joanna showed. Yeah, and then we realized, as I mentioned, Anopheles gambiae SL was more susceptible to the ivermectin, followed by the Culex species and the Aedes species. And it's been confirmed in other studies by the Tenua et al. 2017 and 2022. The only difference is that our population, Anopheles population, seemed to be more susceptible compared to what they tested, but they tested against Anopheles arabiensis. And they had the LC90 around 0.01, and then we had ours around 0.0001. But our Aedes was also more resistant compared to their population that they tested, just that they didn't state the resistance status of the one that they tested. And then the findings demonstrate the potential of ivermectin to be used as an effective toxin against mosquito population, especially Anopheles gambiae SL. And more studies are needed to confirm the lethal doses, especially for other species, or other mosquito vectors. And then there's also the need for trials to be conducted in the field to find how feasible implementing this in the field would be. I earlier on skipped this about the population that we tested. I think 58% of our Anopheles gambiae population were Anopheles coluzi. and then 98% of our Aedes were Aedes aegypti. Thank you.
Thank you very much, Dorothy. It's now time for questions. We are allowed for 3 questions, as usual.
Thank you very much, Dorothy. I have a quick question on your bioassays that you were showing. I want to know the discriminating doses that you were using, whether you ran it along with some controls.
Yes.
Just to make sure that it wasn't other climatic factors that was causing maybe stress for these mortalities, or it was, at least once you are running it, you want to run it alongside with controls to see that if your controls are okay and then you are getting these mortalities, then you are sure of these mortalities that you are getting. Thank you.
Thank you. So we use the diagnostic doses recommended by WHO. I don't have all of them offhand, but they have diagnostic doses for each of the mosquito species. So those were the ones we used. And for the control for Anopheles, we used Anopheles gambi, sensu, stricto, that's Kisumu, yes, as control. But for the Aedes and the killers, we use the same mosquitoes, but we expose them to sugar solution. Not we expose them to untreated papers, not treated or insecticide papers. So those were the controls we used. And their mortality were within 5%, were below 5%.
Yeah, thank you very much. That's a very interesting study. I want to find out about the concentration or maybe the doses that you used in this study. How does it compare with the blood concentrations of the ivermectin that we have actually been using for the MDAs? Because you know we have been doing these MDAs for so many years in the country, even more than 15 years. And we really don't see any, okay, maybe, but we haven't really seen any effect on, let's say, malaria control or something like that. So I want to find out how did the concentrations or the dosage of what you used compare with the blood levels or the blood concentrations or the doses of the ivermectin that we actually use for the MDAs. Thank you very much.
You're welcome. Okay, we actually didn't use the concentration based on the MDAs. We use it based on previous studies that they conducted in the laboratories this way. So we used Tenua et al., both papers, and there was one other paper, Alan et al., 2010 and 2011. So we used their range, and then we conducted trials first before we selected the concentrations that we used. So it was not based on the concentrations being used by the MDAs. And I don't know, I think those ones are tablet also. This one we use the formulation, the one that they used to treat animals. The veterinaries used to treat animals.
All right, thank you very much. What mechanism does ivermectin use to kill the mosquito?
Okay, so ivermectin binds to the glutamate chloride channel in the insect and paralyzes the mosquito, which leads to an eventual death of the mosquito.
Okay. Yeah, Dorothy, thank you very much for the good work you're doing. I think going forward in future, it will be nice for some of the mosquito people to tag along the various MDAs to get to know the effect of the MDAs on mosquito densities post administration. Yeah.
Okay.
Thank you very much.
Thank you.
Our next presenter is Seraphine Tete, and she will be presenting on dynamics of anti-plasmodial effect on Serratia in the gut of Anopheles gambiae, implications for bacteria-mediated malaria control.
Thank you. Okay. Good afternoon. I'm Seraphine Tete, and I'll be taking you through Serratia's proliferation in the midgut of Anopheles gambiae and the effect on the Plasmodium parasite. Okay. So the use of insecticide-treated nets, indoor residual sprays, and artemisinin-based combination therapies have led to the reduction of malaria by about 40%. However, there's been observed a reduction in the effectiveness of these synthetic interventions. Hence, WHO in the Global Technical Strategy for Malaria 2016 to 2030 highlights the use of endosymbionts or some bioactive agents such as endosymbionts in the midgut of the mosquito to combat the disease. So indeed, the disease vector harbors a number of these endosymbionts, some of which have been shown to possess antiplasmodial properties. In this study, I focused on Serratia. Some of the characteristics of this bacteria that makes it an attractive endosymbiont to explore is that, I think Dr. Colley showed this graph. So yeah, it belongs to a family Enterobacteriaceae that are shown to proliferate significantly post-blood meal. This bacteria also has the adaptive feature of producing hemolytic enzymes that help digest blood in the midgut of the mosquito after a blood feeds, and it also shows potential against Plasmodium. So to the rationale, so we are saying there are a number of endosymbionts that have capacity against Plasmodium. However, somehow malaria still exists. So in these papers that have highlighted the antiplasmodial effects of these bacteria, in the experimental setups, they would first of all introduce or challenge the mosquitoes with antibiotics. So like in this paper, they challenged the mosquitoes with a mixture of penicillin and streptomycin to reduce their bacterial loads drastically. After introduction, they would then incorporate their own concentration of the bacteria back into the mosquito, and then they would provide a Plasmodium-infected blood meal. So in this study, I used wild mosquitoes that were not given antibiotics. Okay, and from here, as I said earlier, it's a family, so it would be nice to highlight the distinct proliferation rate of one of the bacteria here that can affect Plasmodium or be a potential against the Plasmodium parasite. So this study sought to answer 3 questions. What is the highest natural concentration of Serratia we can have in the midgut of the mosquito after a blood feeds? What is the effect of introducing this highest natural concentration and an arbitrary high concentration of Serratia on Serratia proliferation post-blood meal? So as I said earlier, other papers would incorporate their own concentration of the bacteria. So we want to compare that to the highest natural concentration we can get. And then what's the effect of these varying concentrations on Plasmodium? So the main objective of this work was to examine the proliferation of the bacteria of interest, Serratia, in the midgut of Anopheles gambiae mosquitoes post-blood meal in a time point experiment, and then check the in vitro effect on Plasmodium. The specific objectives were to quantify Serratia in the midguts of Anopheles mosquitoes post-blood feeding in a time point experiment, and also ascertain the in vitro inhibitory effects on Plasmodium gametocytes. So for the first objective, Serratia massicens, already isolated and stored in the lab, was revived and subcultured to obtain pure colonies, after which I prepared a 10-fold serial dilution of the bacteria in broth, and then plated an amount onto triplicate plates to count colony-forming units. Then I'll know the concentration present in each dilution, and also stored a volume in literature, a volume in RNA, and then took each of the dilutions through these core molecular assays: RNA extraction, cDNA synthesis, and qPCR. And these stepwise molecular assays were used for all my samples downstream. So from the triplicate plates I drew for each serial dilution, I was able to draw a standard curve of the CFU per mil to the dilution factor, and from the qPCR, that is from the core molecular assays, CT to log CFU per mil. So to the time point experiment proper. This experiment was done in triplicates, that's in 3 batches. Each batch containing 2 test and 2 control mosquitoes. And the test group was given blood, and after 6, 12, 24, and 48 hours, mosquitoes were sampled out. They were stored in RNA later, quickly sent to the lab, and the abdomen dissected from the rest of the body. The abdomen was taken through the core molecular assays I highlighted earlier, RNA extraction, cDNA synthesis, and qPCR. So results showed that the bacteria of interest, after blood feeding the mosquitoes, proliferated highest at the 12-hour time point. And from this standard curve I drew earlier, I was able to prepare the dilution factor at which I would get this particular concentration of the mosquito, so I can introduce back into the mosquito for biocontrol purposes. Comparing my results to literature. So in literature, they would usually find Serratia proliferating the highest at 24 hours. From this graph, you see 1D meaning 1 day post blood meal, so that's 24 hours. You'd see that Serratia proliferates significantly after 1 day post-blood feeding, but from my work, I had it at 12 hours, and this might be because I didn't challenge the mosquitoes with antibiotics. And so because there was intact, already present microbiota, there was an early shift in the proliferation window to 12 hours. So for biocontrol purposes, the 12-hour time point might be ideal because it is before the Plasmodium uccanes traverse the mosquito midgut wall. So yes, I reintroduced, from the standard curve that I showed you earlier, I reintroduced that highest natural concentration back into the mosquito, plus an arbitrary high concentration through a bacteria spike sugar meal. And this was done for 3 days. So there was a 3-day introduction of the bacteria, after which mosquitoes were sampled out to test for the success of introduction. The mosquitoes were then starved, and then blood fed. After 6, 12 hours post-blood feeding, they were sampled out and taken through the core molecular assays. So post-bacteria introduction and 6 hours post-blood feeding, Serratia massicens did not significantly proliferate compared to controls. However, after 12 hours post-blood feeding, mosquitoes that were introduced, the arbitrary high concentration Serratia showed a significant increase in Serratia's proliferation rate compared to controls. So from this graph, we can say that the bacteria probably reaches some kind of critical threshold or saturation point when introduced to the mosquito, such that it establishes some homeostasis to keep its balance. And for the 6-hour time point, after introduction of the different concentrations of Serratia to the mosquitoes, we didn't see any increase post-blood meal at the 6-hour time point. And comparing it to the first time point experiment I showed, we can say that with or without the introduction of Serratia in the mosquito, at 6 hours post-blood feeding, we don't expect any significant increase in the bacteria. The results from this particular bar shows that the initial concentration is necessary in predicting, or it influences how much the bacteria would proliferate in the midgut of the mosquito. And that the introduction of natural concentrations of this bacteria would not significantly influence the bacteria's growth or development in the midgut of the mosquito compared to the controls. So for finding out how much the impact of these two concentrations on Plasmodium gametocytes, the two concentrations were plotted back from the standard curve. So I prepared the dilutions that contained those particular concentrations and then spun them down. The palette were then reintroduced to Plasmodium gametocytes on a 96-well plate. And after 30, 1 hour, 2 hours, 4 hours, and 6 hours post-introduction or co-culture, that's the interaction of both the Plasmodium and Serratia, they were sampled out and taken through this core molecular assays. Okay. So, interestingly, the high concentration serraceous reaction to Plasmodium showed that it actually facilitated Plasmodium cell development, while the highest natural concentration of serratia actually reduced the Plasmodium cells, especially at the 1 hour time point. And these results were very interesting and not expected. So upon reading, I came across this paper in which they introduced their own concentration of the bacteria, a high concentration. And upon inhibiting some immune factors, they actually show that in the presence of serratia, P-Beggai Plasmodium was increased. The number of cells increased when they inhibited these immune factors. And so we can say that since my work was done in vitro, in the absence of the vector, that is indirectly, in the absence of an immune response, we should expect the same event or the same result. That's an increase in P-Beggai. So the implications of this study shows that for vector pathogen interaction studies, it is ideal to use mosquitoes that have intact microbiota, because I mentioned earlier that the other studies would challenge the mosquitoes with antibiotics, and so it changed the vector's physiology and microbial activity by increasing the time at which they would proliferate highest. Okay. Also, for microbiota-based malaria control, the concentrations of the bacteria you should be managed so not to inadvertently enhance Plasmodium growth. Okay, so in conclusion, this study highlights the potential of using mosquito gut microbiota as malaria control tools, and also the need to optimize the concentrations used and then maximize the ability against the Plasmodium parasites. So for the dose response curve, we had just 2 concentrations, and so we couldn't draw like a dose response curve of varying concentrations. Also, an in vivo assay is recommended, which we are already doing in the lab, and also transcriptomics and proteomics to analyze and be able to elucidate what exactly is happening between Serratia macices and its effect on Plasmodium. Yes, so please, I'd like to thank Dr. Joel Nakoli, the brain behind this work, Dr. Fred Abuajientri, my supervisor from the Department of Animal Biology and Conservation Science. He's the chair for this section. Wellcome Trust Intermediate Fellowship for funding this research, the Department of Parasitology, the Vector Research Group here in Noguchi, the Mosey Biome Lab, Vestergaard, Department of Animal Biology and Conservation Science. Thank you for your attention.
Thank you, Seraphine. Please, let's have a maximum of 3 questions for Seraphine. And please, let's keep it simple so that we can move fast. Any question for Seraphine?
Yeah, Seraphim. On slide 16, you talked about P-Beggai. I think all the slides are 16, eh? Yes, this one. And then, yeah, you were saying that you could extrapolate your results just like the previous one. Do you think it's a good thing to do? So from the previous work, they worked on P-Beggai, right? And from what they reported, there was an inhibition.
An increase in the Plasmodium cells.
An increase?
Yes. after introducing the high concentration Serratia, they rather found an increase in Plasmodium cells after they...
So it was an agonist?
Yes.
Okay. And you want to infer that from your work too, or you are predicting that if you should increase?
No. So the point I was trying to make was, from my work, I was expecting that introducing a high concentration Serratia to Plasmodium would reduce their counts. Is what I expected. However, the high concentration Serratia rather kind of increased Plasmodium cells. And so in my work, in my in vitro study. So for this work, it was done in vivo. They
just like the previous one.
This is the same paper.
Okay.
Yes. So they introduced the high concentration Serratia, and it increased Plasmodium when they inhibited some immune factors. So I would assume that because my work was done in vitro, that's to say there's an absence of the vector and indirectly an absence of an immune response. That's how come I was seeing the same effects.
Result.
Yes, please.
But you worked on falciparum.
Yes, please.
Okay. Yeah, we just have to be careful when we are interpreting our results. Okay. Yeah, it's because that one is a model species. Parasite. Okay. Yeah.
Yes, please. Thank you.
Okay, thank you very much, Seraphim. So for our next presentation, we do have Augustine Somoa, who will be presenting on the topic assessing the impact of different water types and feeding regimes on mosquito size development and adult survival.
Good afternoon. So I'm Augustine Somoa from KCCL, and I'm excited to present our study on assessing the impact of different water types and feeding regimen on mosquito size, development, and adult survival. So malaria is a major public health concern to sub-Saharan region because we suffer the highest global malaria burden, and there's a need for us to understand the transmission dynamics through the mosquito parasite-to-human interaction. And this will enable us for effective vector intervention. And these transmission studies needs laboratory-read colonies. And for these studies to be meaningful, we need healthy and consistent mosquito production for these studies. And laboratory condition has been shown to affect the survival and the development and the fitness of mosquitoes. And specifically looking at the water types in which they are read and the feed regimen in which they are given. So optimizing this condition will enable us to effectively assess the survival, the body size, and the vector capacity of this mosquito species. So our study, we aim to determine the effect of 3 water types, that's tap water, deionized and mineral water, and increase feed on the quantity of wearing outcomes in the lab. That's for the Anopheles gambicutum strain. And we set out 2 main objectives under it. So first, we wanted to compare the effects of tap water, deionized water, mineral water on the development of the aquatic stages, that's the larvae and the pupae. And finally, we look at the effect of these water types and increased feed on the adult body size. So first, as I said, we just use Anopheles gambicutum strain, first instar larvae. We read them under constant in-situ condition, that's 27 degrees Celsius, relative humidity of 70, then that's a 12-hour and a 12-day cycle to maintain consistency throughout the whole experiment. And for the larvae, we fed them on 2 feed regimen. That's the standard and the increase. The standard was gotten from a reference lab. That's when we were starting our colony. And based on that, we increased it 50% to see the outcome on the mosquitoes. So based on the age of the mosquito, that's the 0 up to, we fed them on the corresponding feed regimen. Once they emerged, they were provided with 10% sugar solution. So under each of the water types, we had 2 fed regimen with 200 mosquitoes and 3 replicates. So in total, we had 7,200 mosquitoes for the whole experiment. We have 2 badges. This to represent the 2 sets of eggs that we received for our lab, one from France and one from Obuasi. So 4 days after emergence, we selected 20% of our mosquitoes for dissection. We dissected the left wing for consistency for both males and females. We captured them under the microscope. We uploaded them under image Fiji software. And this is the picture showing how it was measured. So from the tip of the radius vein to the distal end of the annular. Okay. So some of the results that we came across. So increasing the feed regimen across the water types, we saw that deionized water shows substantial survival for the aquatic stages. And you can see that when you compare it to the other water types, it really enables survival of the aquatic stages. But something intriguing happened to us. We realized that the standard feed rather promoted the survival compared to the increased feed. We weren't expecting that. But this we attributed that, increasing the feed regimen in a way will lead to turbidity of the water, which will increase microbial contamination. And we discovered that some are to advantage and some are disadvantage to the mosquitoes. So we realized that the standard feed rather promoted the increase rather decreased. Thus, we discovered, higher mortality within them. And increase the standard feed across the water types, we realized that the increased feed produced substantial, pupa reduction time across the mosquito species, meaning that the increased feed reduced the time to pupation across the water types. And we saw that between the deionized and the mineral water, the p-values were significant, all right, but we saw that the deionized water was way, smaller compared to the mineral water. This we also attributed that the deionized water lack mineral content. The mineral contains some mineral content. So this, in a way, the larvae in these water types depend on the feed that was given to them. So the more you increase the feed, the more nutrient for their survival. But the mineral water contains some form of nutrients. So in a way, didn't actually enable them to use the nutrient that was given to them. That's why we attributed that we saw a lot of improvement in the deionized water compared to the mineral water. So across the wing length, we saw that for increasing the feed, there was substantial increase in wing length within the male species. That is, the wing length actually tells the body size of the mosquito. So once the feed regimen was increased, in a way it produced bigger mosquitoes. We saw that in the males as well as the females as well. We increased the feed, we had bigger mosquitoes in them. We also saw something that we were expecting actually. The females had bigger wing length compared to the females. And we know that in generally the mosquitoes the females have bigger wing length. And this wasn't surprising to us. And we saw a slight difference in the water size, but which was not significant as well. So in conclusion, we had some things to present to you. So using the deionized water as a main water for your aquatic stages in the lab will enable larval development and also promote nutrient absorption. Secondly, we saw that increasing larval regimen can negatively influence survival of the larvae, which is shocking, but it also reduces the time to pupation. The size of the mosquito is influenced by the feed quantity, but not the water type. This is what we discovered. So based on this, we recommend that extending this to the wild colony strains to see if this same result can be translated to them, because they are the main vectors that transmit the pathogen to humans. These are references that help to prepare the slides. I want to acknowledge our partners, our funders and collaborators who helped to bring this work, especially to our group leader, Dr. Umumaiga Askufari, who helped to sponsor us for this conference, to the entire AGMA group, we call them Infectious Disease Epidemiology Group at KCCR, and to the entomology group at large. Okay, thank you.
Thank you very much, Augustine. It's now time for questions.
Hi, Augustine. That was a very good one.
Thank you.
My question would be with your insectary work, insectary maintenance.
Okay.
You made mention that increasing the feed, you were expecting to see an increment in the size of the mosquitoes. But I think that's not the only factor that determines the size of a mosquito. So then I'm asking you, with your experimental plan, how many larvae did you have in a particular larval bowl? And then what was the volume of the water you used to rear the mosquitoes? Because I think that's dependent too on how fat or slim the mosquitoes would be.
Sure. Thank you for the question. And I do agree with you. Other factors come into play. And for each of the larvae, we had 200 mosquitoes each. We use 3,000 ml water. And this in a way, and so in total, we had almost about 2,400 for each of the water types. So in each larva bowl across, we had 200. Yes, and we ensured the similar condition throughout. But then, as you said, it's true, other factors come into play, which we are yet to discover in our subsequent kind of research.
Okay, the second one, sorry. You made mention, I think, I don't know, maybe it was a slip of tongue or something, that the females had larger wing than the females.
Oh, okay.
So
Okay,
I need clarity on that.
Yes,
Like, I really,
okay.
what were you trying to mean?
Yes, that's fine. So let me clarify it. It was something that actually we were expecting. The females had larger wing length compared to the males. Is that fine? Okay, thank you.
Thank you so much for your insightful presentation. I think it will be very helpful for those who are running colonies, raising different generations of colonies,
Yeah.
where we normally look to, if we could speed up the development of the larvae. I think some of these things are very insightful. But I wanted to recommend, can you also move it to the other species and probably genus as well, to see if you are finding something similar to what you did with the Anopheles gambi?
Thank you. I think that's true. You meant maybe for Culex and for Aedes. Yes, that would be really important. And so the first step for us, we are looking at translating to the wild colony. And once that is done, we will look at the other species as well to get a better representative view of the vector kind of behavior.
All right, thank you, Augustine, for that insightful presentation. I don't know if it was a typo. Did you dissect the wings or you measured the wings?
Okay, thank you for the question. So let me go to British entomology. In entomology, anytime you use a forceps to take any part of So Dr. Colin has suggested it.
Let me listen.
So yes, we just took off the wing. Yes, it's also a form of dissection.
You just
I don't know if you're okay for
detangled
that.
it and then you measured the length. It
Yes.
was measurement, that's not dissection. And then the second one, you said, I think that gentleman asked about the increased feed. You know there are other factors.
Yes.
You want to look at the photoperiodicity. Maybe the humidity, temperature, and all those things actually speeds up. Okay? So if you are talking about increasing the feed, I don't really know how it was comparable with your other ones, because with that self, you can actually suffocate them and they will be dying. You have a lot of colonies dying. So maybe you should look at it critically.
Sure. Thank you. We'll look into that.
Okay, Augustine, thank you very much. I saw that in your reference, your first paper was Apodiate et al. Their work is almost exactly the same as yours. How different was your result from theirs? And also, in Ghana, when you talk of mineral water, what do you mean? Is it the actual mineral water you get from the supermarket or the pure water? So-called. Because I think if you had clearly categorized the water quality properties of all the various sources of water you use, it would have been much helpful.
Thank you for the question. Yes, I think I do agree with you on that. We actually didn't look at the water quality, but then we used one of the form that we thought at that time to be the purest form. So it was just the mineral water. We used EverPure. So in our subsequent research, we want to look at the specific parameters to be able to know that this and this is what actually is influencing the outcome we are seeing.
Because in your reference list, the first paper that you referenced, yeah, that one, they found that mineral water was the best for rearing the mosquitoes.
Yes.
And the reason they gave was that it contained these dissolved minerals that could be essential for larval development and growth. In our case, if you say the pure water on the street, it's just tap water that has been filtered in most cases, because some do prepare it in their own backyard. Yeah. So, as I said, it would be good for us to know the water quality parameters for all the various water sources that you used.
Thank you. We'll take into consideration. Thank you.
Thank you very much, Augustine.
Our next presenter is Lucy Amwa. She is presenting on host specific cues. She is presenting on host specific cues cause differential attractiveness to human baits to mosquito vectors.
Good evening, everyone. My name is Lucy, as he mentioned earlier. And then it happens to be that you see a different topic or title for my presentation. There were a few modifications, so nonetheless, it's the older or the previous title is relatable. So thank you for understanding. So, mosquitoes are known to be vectors of medical importance, which are known for transmitting pathogenic diseases ranging from viral to parasitic infection, and also the variabilities in attractiveness to host-seeking mosquitoes is mostly caused by the differences in the makeup of the body emanation, as well as the olfactory cues or signals. These studies have been somehow limited due to the fact that most studies have been laboratory-based, which uses odor obtained from the body parts of humans, as well as, secondly, being filled in the field setting, which also uses the visual, physical, and chemical cues of the host. Evidence for the attractiveness based on body emanation and infection remains limited in spite of the far-reaching epidemiological implication of this phenomenon. So we aimed at assessing host-specific cues that cause differential attractiveness of human base to the mosquito vectors. And then specifically, we went ahead to do a validation of our experiments, which we do compare the dry run to the human base. And then also we did compare the dry runs from the same pairs. And then also there was an exploratory analysis which assessed the relative attractiveness of mosquito to schistosomiasis infection. So these are the methods. We had 25 males which were matched by age, and then lab-bred Anopheles mosquitoes aged between 3 to 5 day old were used for the analysis or the experiment. So this is a sketch of our olfactometer with having 10. So the olfactometer is it has 3 compartments, which the middle chamber is where we do release the mosquitoes for them to make their choices based on the olfactory or the possible attractant based on the possible attractant of the human or whatever is in there for them to move towards it. So this is a sketch, and then the actual experiment setup we have at our facility. So after the experiment, we came out with the results, which we did compare the dry run. So the dry run is actually the test which was done without any human bait, with all controlled factors. So the result shows that looking at the dry run, we use a total number of 2,989 mosquitoes, for which 226 made a choice, representing 7.6%. And then with the human baits, total number of mosquitoes used were 6,124, which out of that 2,171 made choices, and then which shows that comparing the dry run to the human baits, there is a difference, which which means that human baits indeed there was an increased attractiveness comparing the dry run to the human baits. And also we had look at the chamber effects, where the mosquitoes also, we could see an increase in the human bait compared to the dry run, an increase in number with the human bait compared to the dry run in here. So this is our so the interaction between individual pairs and then the chambers. So we also did, as we mentioned in our experimental procedure, that we did compare mosquitoes, So we did the experiments, which the number of pairs for the initial experiments, and then afterwards they do switch tents. So we wanted to see the effect of we wanted to see the effects that, or the result or the effect that comes up as a result of switching or swapping, whether it is attributed to the human or there are other factors. So from this table, we could see that the choices, there wasn't any really differences regarding the number of choices, or the same individual pairs had the same number of sorry, there was a reflection actually with the experimental procedure when the pairs were switched in between tents. However, there were few exceptions to the experiment, which was realized that at the end of the experiment, the numbers that we had did not reflect for an individual participant. There were actually significant differences between the values, which indicates that the swap in a way could not reflect. So moving on to the exploratory analysis or the preliminary experiment that we performed regarding the malaria and then schistosomiasis co-infection. We used 8 pairs of individuals who were infected with Plasmodium falciparum as well as schistosoma hematobium that were detected by microscopy. So this is how the relative attractiveness is calculated, where the Y represent the number of mosquito for the case, as well as the N representing control. So for this test, for these results, we could see that the relative attractiveness for before treatment compared to after treatment there is actually an increased relative attractiveness. And then looking at the pre-treatment section, for example, the per IDA1, we could see a lower relative attractiveness, which is an indication that the mosquitoes rather make choice to the control rather than the cases who were co-infected with the malaria and then the schistosomiasis. And then also looking at the post-treatment, we could see a significant increase with the relative attractiveness after the praziquantel was given for those who were infected with the schistosoma hematobium. And then we also came out or realized an interesting part where after we could see that for the clearance for the Plasmodium falciparum as well as the schistosomiasis, there was a reduced relative attractiveness at the post-treatment section, which is which is quite an interesting area to be looking at as we move on with our studies. And then also at this section, we could also see that the co-infection, comparing the pre-treatment to the post-treatment, we could see a high increase in the relative attractiveness for individuals with a co-infection. For instance, the pair ID B1A had an relatively increased attractiveness, and then also similar with the C1 and then C1A as well as the B. So it's also another question that is being raised, whether the treatment with praziquantel has any effect on mosquito attractiveness, which I believe it's an interesting area to be looking at with regards to mosquito behavior or mosquito attractiveness. Okay. So with the results and their experimental procedures, we conclude that two-step validation was effective since from the results shown, most of the mosquitoes were activated to the tent where occupants were in there, and then also switch between results did not really affect the attractiveness. Thirdly, we could say there was no systematic attraction to the schistosoma infected individuals. However, we could see an increased attractiveness after the treatment. So we can, as I said earlier, it's a question that has been raised, which we find it interesting to go, delve more into it, the role of praziquantel treatment in mosquito attractiveness. And then finally, we could say, or we conclude that the development of the olfactometer could be used as a reliable tool for measuring mosquito attractiveness. These were a few references I used to prepare my slides. And I would like to acknowledge my partners and then collaborators for this study, especially to our group leader, as well as the infectious disease epidemiology research group, and greater part to the entomology team at KCCR for making this work a success. Thank you very much for your attention.
Thank you, Lucy. It's time for questions.
Thank you, Lucy. I think personally, I'm a bit confused about the dry run and the human bait bit. You had two compartments to your olfactometer, and I was expecting that the experiment would be you release the mosquitoes in the middle and then see where they choose to go, whether towards the human baited side or the non-human baited side. So which part is the dry run?
So the dry run is actually the part which it is done without any bait. So it is a way or like a benchmark to validate the actual experiment. So we do compare the dry run to the human bait and then see if...
so can you please go back to the results of... You had dry... Yeah, here.
Yes, please.
So you released 2,989 mosquitoes into the middle of the chamber where there was no human on either side, correct?
So
that's
yes,
your dry run.
So it's actually cumulative results. So for each, we did perform 17 dry run per experiment.
Oh, wow.
So
What?
it's a
17.
Yes. So for each experimental procedure with the human bait, that we have to do a dry run, and then afterwards we do validate or we do compare.
So in this case, your p-value means there was no difference between how many mosquitoes that chose A against B.
Even though we see an increased number with the human bait.
And here too, it means even though the human bait, let's say, was in chamber B, you don't see any difference between the human baited, the choice that the mosquitoes made towards the human baited against the one that didn't have. So the first one is kind of fine.
Yes.
The bottom one means that there was no difference between how many mosquitoes chose the human bait against the one that didn't have the human bait. That's what this means.
Yeah.
Or am I getting it wrong? Oh, you see, so that is not clear. They will choose A against B or B. So why is your control not an empty chamber against a human baited chamber? You throw the mosquitoes in the middle and let them choose what they want. Why would you have a test, one test that has nothing in all of them, another test that has both sides? I mean, I'm sorry, am I the one making a case? Yeah, I find it a bit weird because for every test you need a control. So if you've separated your dry and your human bait, what if that day there was too much wind in the one that had the dry run that day? Okay, you need to do your dry, your non-human and the human bait at the same time. Then you let the mosquitoes choose. Would they go? Then in another replicate, you will swap. The human will go into A this time, and then the non-human will be at the B. That's when you test whether is it the direction of the wind that facilitated the choice, or it is the bait itself. I find a bit strange how you've designed your test, I'm afraid. And you didn't give me a rationale as to why you did the schisto work. I was like, oh, schisto.
Okay, so there's actually been a study that has done a work in the mice model in which the infected, they did treat the schisto and then the schistosomiasis with the praziquantel. So it was realized that after the treatment, there was kind of an increased attraction towards the mice that were treated post-infection. So this is one aspect that we intend to look at, whether the effect of the drug on mosquito attractiveness. So that's how come.
Thank you for the presentation. I want to, get some basic information or education. I've heard your presentation and the one before you talking about Kusumi strain. Sure. Is it a Ghanaian strain, or if it is not? What is the word is from Kenya, right? Yeah. Kisumu strain. Why are we using Kisumu strain and don't have any strain from Ghana?
Okay. Thank you very much.
Because I'm asking that because we are, looking at trying to also help. So while you could have the Kisumu strain, but then you should also have a local strain or something that you are developing from here. Okay. And that is why I'm asking that question. Okay. Joanna actually talked about the issue of schisto. And I was also interested in is there any publication or is there any literature that is looking at maybe schisto infections treated, okay, where people are having more infections with, or maybe with malaria or something. Okay. That is why you are interested in looking at that co-infections.
Yeah, thank you very much for the question. I think I did answered that question a few minutes ago, saying with the fact that there's been a study with the mice model, which they did treat those infected with the schistosomiasis, and then it resulted in an increased mosquito attractiveness. So for the question that was raised was, is the increased attractiveness relatable to the treatment with the praziquantel, which we are also interested in, that which we want to have a look at.
Yeah, that's what I'm asking, because we have human infection. You understand?
Yes,
please. You are looking at animals. And a study has been done that shows that the animal, to some extent, when they are treated,
yes,
you have more mosquitoes going in the bite, right?
Yes, please.
So we have, people who have schisto infections who are treated. Is there any, wouldn't it have been good for you to maybe find any report?
They actually
with infections where following ND there is more malaria or maybe
okay. Yeah.
Just go back and repeat a similar thing.
Okay, this is actually an ongoing experiment which we are on, hopefully to get results regarding the schisto infection and then the mosquito attractiveness. So it could be of interest. Thank you very much.
Okay, so I would say that thank you very much for having that bravery to present these results, because as a researcher, mostly when your question of evidence or interest is not significantly statistically, or there's no evidence towards that, you begin to question that. But then you've been able to present that for us to see, and I believe that is a platform for us to also learn. I would want you to go to, I think, your next slide or two. Yeah, the next one, where you talk about the, I think, yeah, this one. Okay, sure. So you have mosquitoes chamber case for Y and Z, and you term that as a relative attractiveness. I don't know if you mentioned that, but I want to ask, what will happen if you have more mosquitoes in Z compared to Y, and then vice versa? And what will be your interpretation to that?
Okay, so in this case, I believe the relative attractiveness, there will be an increased relative attractiveness, implying that the relative attractiveness more than 0.5, which will be an implication that the cases are rather attracting more mosquitoes than the controls. Come again. For the attractiveness with the treatment, so that's there is a control. So the controls are, we match the pairs. We have the schistosoma positive, and then those controls are those without the malaria and then the schisto. So that's our control against our case were paired.
Okay.
So the results here is showing that with relative attractiveness, which is less than the 0.5, indicates that the controls were rather attracting more mosquitoes than the cases.
Okay.
Yes, please.
I could see that that is also a ratio, a proportion between 0 and 1 with that value. So basically, if you have more Y than that, then you'll be moving close to 1. And then if you have Z more, you'll be moving close to 0. So you set your baseline between 0.5 to make that.
Yes.
Okay, thank you.
You're welcome.
Thank you, Lucy, for the wonderful presentation.
Thank you. So we have our last presenter for the day in the person of Aaron Ajinlate. And he will be presenting on assessing the behavior of mosquitoes during exposure to different long-lasting insecticidal nets using the video cone test.
Thank you, Chair. I know time is fast spent, so I'll be as brief as possible. So I'm Aaron Ajinlate, and I'm here to present on the topic assessing the behavior of mosquitoes during exposure to different long-lasting insecticidal nets using the video cone test. So malaria has been and it still remains a major public health issue, especially in sub-Saharan Africa. And we in Ghana, we are no exception. Vector control tools are the main tools for controlling malaria. And as part of the vector control tools, we have long-lasting insecticidal nets which are used for malaria control. Over the years, most of these cell lines are pyrethroid-based, and over the years, we realized that the mosquitoes are building resistance to the pyrethroids, making the L lions inefficacious or ineffective. So the major tool to to evaluate these LLINs is the WHO cone bioassay. But the WHO cone bioassay have just two endpoints, that's the mortality and knockdown. It doesn't take into account anything about behavior. So what this study is doing is we are trying to use a new method called the video cone test. It just uses the WHO cone bioassay, but it incorporates a camera to record the behavior of the mosquitoes when they are exposed to the LLINs. So the aim of this study is to assess the behavioral characteristics that mosquitoes exhibit when they come into contact with different LLINs. So I have three main objectives: to compare the behavior of susceptible and resistant mosquitoes during LLIN exposure using the video cone test. So the susceptible mosquitoes and resistant mosquitoes we are using here are lab-bred strains. Susceptible mosquitoes are the Kisumu strains, which were gotten from Kenya, and the resistant mosquitoes are the Tiasale strain, which was gotten from Cote d'Ivoire. They are all lab-bred. And we also want to compare the behaviors across different LLIN treatments. And the last objective is to assess the relationship between exposure time and mosquito mortality. So for this work, basically we had three classes of nets. We had the untreated nets, we had pyrethroid-only nets, and then pyrethroid PBO nets. So what we did was we exposed 5 mosquitoes to these classes of nets in the VCT setup. So as you can see here, this is the setup for the VCT. You can see the normal WHO cone bioassay setup here with a smartphone which serves as the camera component. So we expose the mosquitoes for different time frames. That's 1 minute, 2 minutes, through to 6 minutes. And after we did, while we were doing that, we recorded the behavior of the mosquitoes. So after we recorded the behavior of mosquitoes, after exposure, we put the mosquitoes in holding cups, gave them access to sugar solution, and then we took the videos and analyzed the videos. Now we used 2 different softwares to analyze the videos. We used the Boris software and the Vector software. The Boris software was looking at 4 main behaviors. That is the mosquito being on the cone, being knocked down, resting on the net, or in flight. And basically it's looking at these behaviors at different time points. So at every 5 seconds, you pause the video and then you try to see if you can see the mosquitoes, each of the mosquitoes, or what the mosquitoes are doing at that point in time. And then the Victor, what the Victor was doing was it was recording the movement of mosquitoes throughout the exposure time. So it was recording the movement frames of each mosquito during the exposure times. And like I mentioned, because we gave access, access to sugar solution for the mosquitoes, and then we looked at the mortality after 24 hours. So because for this presentation, I'll focus on the results for the Vector software. So you can see a cone-like structure here, like a pyramid. This represents the cone we use for the WHO cone bioassay. And you can see places labeled 0, 1, 2, 3. These are the different regions of the cone that Vector, so Vector actually, it segregates the cone into regions, and then it looks at the movements in each region of the cone. So what I did was I classed the regions of the cones. I classed region 0 and region 1 as the regions away from the net, because the base of the cone is what is closer to the net. And then I also classed the regions 2 and 3 regions closer to the net. So you can realize that from the behavior by net class, the untreated net had lesser activities in both mosquito being closer to the net and away from the net. And this is because realize that for the untreated net, the mosquitoes they were not moving most of the time. They were mostly either resting somewhere on the cone or somewhere on the net. They were not moving at all, so the activity was less. You could see that for pyrethroid only and pyrethroid PBO net, for pyrethroid only, we had very much movement in the area closer to the net, same as the pyrethroid PBO net. And this is all higher than the untreated net, same as being away from the net, which basically means that the mosquitoes were kind of agitated, so they were moving a lot. And when you look at this, I was trying to compare the mosquito activity away from the net and closer to the net by strain. And like I mentioned, the Kisumu strain is a susceptible strain, and the TSLS strain is the resistant strain. So you could see that the Kisumu strain had lower activity closer to the net as compared to the TSLS strain. And then for the mosquito behavior, for the mosquitoes being away from the net, the activities were kind of similar. And this activity being closer to the net, the resistant strain was probing a lot. I mean, the susceptible strain, most of them, when they kind of get down, they just either try to go up or they they just fall. But for the TSLS strain, they were probing a lot and they were getting agitated a lot. And that's why you're seeing this. Also, I decided to check the effect of the different times of exposure on mortality. And we realized that there was a linear trend between the exposure time and mortality, and this linear trend was significantly positive, and the nonlinear terms were not consistently significant. What this basically means is that you can see that the line is not a straight line, it has some curves in them. So I was trying to see if probably the curves that you're seeing, they are kind of significant, because basically we know that when you increase the mortality, the exposure to LLINs, the mortality should be higher. And I realized that these were not significant. So basically, the trend was linear, even though you have this there. So to conclude, I like to say that mosquito behavior varies by strain and the type of LLIN, and the longer exposure times were able to predict the mortality of mosquitoes. And the VCT provides valuable behavioral data, and it informs more robust LLIN evaluation. I'd like to recommend that further behavioral studies on mosquito LLIN interactions be done, and also we need to adopt behavior-based evaluations methods like the VCT for LLIN assessment. I would like to acknowledge Prof. Dadzi, Dr. Joanna, and Dr. Bewa. They've been really instrumental in this work. I also like to acknowledge the staff of the Vestergaard VNVL Lab and the LSTM for bringing this project. Thank you.
Thank you very much, Aaron. It's now time for questions. Yeah. Chavi.
Okay, thanks so much. Thank you, Aaron, for the great presentation. I was expecting two things. First, let me start by the recommendation. You know, cone biopsy started before you started crossing the road, like ages. Maybe you may not, you know what, have so much grown to cross the road. So it means that cone biopsy exists before you were born. Yeah. So I was expecting you to recommend the WHO that cone biopsy is old now, so we need to process another way to make sure that we have the data that reflect currently the LLIN process. What does it mean? Should we reduce the cone, cut it, or whatever? But how do we do to get the third layer of your presentation where you feel like, okay, maybe from the third layer, the mosquito contact will be a little bit, on the net. So the recommendation should be rather tell WHO that, okay, let's change things. That's one. The second one, there are some of the aspects that you may also look at as you compare Kisumu, which is susceptible, with resistance. You know how resistance happen and how the mosquito can behave because they have the resistance markers. So their contacts on the net should be different. Because they are susceptible, they don't feel any excito or repellency or whatever it is from the chemical. But when they are resistant, they feel it, faster because they feel like, okay, I can start on it, but not really, but they are more excited. So this is some of the aspects also you have to look at to get your conclusion. It may not be a question, but something to help you. Thank you.
Thank you.
Yes, okay. Thank you for your presentation. Maybe can we go to the slide where you have your bar graphs? Yeah. Yeah, this one. On your Y scale, you have total activity, right?
Yeah.
And then I could see the values are in scientific number. So I think your highest value is 0. Is it 005 or 05?
It's 6 exponent 0.5.
6. So that means 0.0006. All right, 5
no,
times.
6 exponent. So like it has like 5 zeros.
Have 5 zeros.
Yeah.
Oh, it's 6
exponent plus
okay,
0.5.
Okay, then that is fine. I thought it was in decimals.
No.
I wanted to ask if it was in decimal, then I would have asked whether there wasn't much room for the mosquitoes to be able to measure their behavior. But since it's that, thank you.
All right. Thank you.
Thank you so much, Aaron, for the enlightenment. You studied about the behavior during exposure. I think it will also be nice to study the behavior post-exposure, how they are able to come back to life, like resurrect with a KDR.
Yeah, so it was part of the project. We are still on it. I mean, it's a larger project. So it's part of the VCT Essentials project. So we are looking at the sublethal monitoring after exposure. Will the mosquito be able to take a blood meal? How is the fecundity going to be like? How is the offspring going to be like? We looked at all this. So it's something we are still working on. And when the results, I think they've been published. I have to check, but I mean we have that data too. Thanks.
Okay. Yeah. Thank you very much, Aaron. Yeah, we also like to thank all our presenters, plenary, and all. At this time, I also like to thank you for staying with us till the end of the day. I'll hand over to the MCs so that if they have any announcements.
Thank you very much, Chess. I think Dr. Fred did the two appreciations that are very important. One goes to you, so let's do it again. Thank you for staying this long. And also to our session chairs. Thank you, Doc, and all the session chairs. And also you who presented, you who sat through all the presentations. We are very grateful. A few announcements just before we leave. So one is that tomorrow is a promising day because there are a great lineup of sessions, very interesting ones. But also the icing on the cake is that after serious work, there's also going to be some party. So there's going to be a cocktail that will be after tomorrow's session. So do well to come early, let's close early, and then have the cocktail. Also the third day, which is Wednesday, scheduled to be an AGM, an annual general meeting, which is very, very important. If you are here and you are a Pamca-Ghana member, this is your meeting. This is where you get to sit. Tell us your ideas to make the association even better. And do this also by confirming that you are really a member. If you're a member, you attend meetings. So come to the general meeting on Wednesday. We are going to be adorned well. One of the ways we want to do is to represent ourselves well. Presdo has given us nice T-shirts. Please, if you are here, you don't have a T-shirt, find one. Even me, I've gotten one. So you definitely get your size there. So please, do well to pass by the front desk and then you get a T-shirt. On Wednesday, we are all wearing the T-shirt. So please get a T-shirt if you don't have one. I can see the smoke man shaking his head. I don't know whether he's thinking of how to convert the T-shirt to the smoke, but we'll definitely find you something to wear. Wear the T-shirt for us only for. As for Wednesday, you are pardoned. So that is fine. The other announcement is that, not really an announcement, but it's actually a big appreciation. I don't see our sponsors here. I don't see Takio, but I think is Mr. Sebaya still around?
but our platinum sponsor, Syngenta and Mitsui Chemical, they are not here, but let's appreciate them very, very much. They are the reason why we see ourselves here gathered. Yes, I'm actually coming. So they are our platinum sponsors. And then when it comes to EK Consult as well, a wonderful one for EK Consult. I could see the man eyeing me. He almost took me out of the presentation if I didn't mention his name. So EK Consult, thank you very much. You have done a good work. It's just the sound small and then we are okay. Thank you, EK Consult. We have gold sponsors, Health Alliance. Mr. Fume has left, but they've also done very well in sponsoring us. And then AFO, Noguchi. Please, let's clap for ourselves. I think we form like 2/3, and we really appreciate you. And our silver sponsors, we have LabMat. Our bronze sponsors, we have, I always need to swallow, Acomvec. That's our modeling consortium. So thank you very much. The last announcement is that for those of us doing oral talks, table talks, and posters, so oral talks and table talks, if you haven't uploaded or sent your presentation, you know how you were reached in the email. Please do well to send or submit your presentation to that email. And then table talks, you do same. For our posters, please make sure your posters are up on the board. There's down there, you see the booth. Please get your posters up for tomorrow. And on that note, we will thank you all for coming and would ask that we stand up. We didn't really pray before we started, but we will do well to pray and end. I think it has been a good day and all praise to God. So we'll stand up. I see Christopher shaking his head. Looks like he's in the spirit to pray. So would ask the best dressed gentleman in the house today to come in to pray with us.
Okay, shall we pray? Our Lord and Master Jesus, we thank you for a successful ceremony. We are grateful for all the insight and knowledge we've acquired during this program. As we step out, we pray for protection and guidance as we go to our various homes, that tomorrow you bring us here back successfully to continue to the end of the program. This is what we ask, O Father, in the name of your Son, Jesus Christ. We pray. Amen.
Amen. Thank you. Executives, please